Surviving the Storms in Our Minds, Fixing Unhelpful Thoughts While Parenting,
Okay, 10
hosted
seconds,
by
guys.
DC Moms and the DC Department of Human Services.
My name is Ashley White Corbett, and I am the mental health clinician for the DC Moms Partnership Program at the DC Department of Human Services Economic Security Administration. It is such a pleasure to be here, and we are so thankful for the opportunity to share some important information with you today. I want to acknowledge my director, Laura Zeilinger, who is a huge proponent of family sustainability, and also our administrator, Anthea Seymour, who is an amazing and wonderful visionary, supportive of families coming together through the two generation intervention approach and supporting the entire family unit. I want to also thank Muriel Bowser for such an amazing opportunity to learn about and to discuss health and well-being on such a huge platform. This summit proves how critical education and advocacy is in terms of national issues around maternal and infant health. Now I'm going to bring up my fantastic colleagues who will be co-presenting with me today, Ms. Sabrina Tate and Ms. Willette Burton.
Good morning, welcome. My name is Sabrina Tate. I am the CMHA for the DC Moms Program. And again, welcome to this fabulous presentation that you're about to get.
Good morning. My name is Willette Burton, and I have the pleasure of working within the Office of the Administrator. I'm a Program and Policy Analyst. I also work with DC Moms as a project coordinator. Today, I'm actually going to be an energy engineer. So you may ask, what is that? That means I'll be in the chat receiving all of your positive feedback and encouraging you to participate with my colleagues as you go on this journey.
Today we will be discussing surviving the storms in our minds, fixing unhelpful thoughts while parenting. Here's our agenda for this breakout session.
Okay, let's go over the guidelines for the virtual presentation. First, feel free to use the chat box to ask questions or make comments. If we may be discussing sensitive topics that may cause some discomfort, please feel free to step away to take care of yourself if this occurs. Thirdly, please be respectful of all attendants' point of view. Lastly, be open to learning something new about you. I'm going to be going over the mission statement for the DC Department of Human Services. The mission of the Department of Human Services is to empower every district resident to reach their full potential by providing meaningful connections to work opportunities, economic assistance, and supportive services.
In alignment with our agency's mission, we have adopted a program called the Mental Health Outreach for Mothers program, right? So it's called DC Moms. And DC Moms is a replication of the Moms Partnership Program that originated in New Haven, Connecticut by Yale University School of Medicine. In 2017, we formulated this partnership in order to bring supportive maternal health services to mothers in the District of Columbia. We use the cognitive behavioral approach in efforts to help mothers decrease depressive symptoms and anxiety, as well as reduce social isolation. We have a program that is structured in the form of classes, right? So we have an 8-week stress management course that allows mothers to learn skill sets that will allow them to manage these depressive symptoms and be able to formulate a cohesiveness and a sense of community in our classes. The course runs for 8 weeks, and we have multiple topics that help mothers understand awareness of their thought process through metacognition. We also teach executive functioning skills because we believe that your work must be done internally before you go out into the workforce and provide and perform work for other people. You must be in a state of peace and balance. And unfortunately, when we are experiencing depressive symptoms and we are worried and overwhelmed as parents, it can get in the way of us engaging in education activities as well as work readiness or work or job activities, right? And so we also teach mothers how to recognize unhelpful thought patterns that then lead to mood dysregulation. And it also then leads to behaviors that may not be acceptable in terms of societal standards or just behaviors that are not conducive to parental interactions or interactions with other individuals. The DC Moms Partnership Program also is predicated on the 2-generation intervention approach. It has the sense of touching each and every component. There are 5 components to the 2-generation approach, but we focus primarily on mental health and well-being as well as social capital. So in terms of the mental health and well-being, I am the clinician, and so I am helping mothers process what is happening in their cognitive distortions. We are talking about how to reframe those thoughts, those feelings that might get in the way of their health and healing and progress. Ms. Tate, who co-facilitates the course with me, she is the community mental health ambassador. And so while I'm really serious and clinical when it comes to making sure that the moms grasp those skills, she kind of brings humor and let mothers know that, hey, I'm here with you. And so we stand in solidarity with those mothers because we have a shared journey. Oftentimes it is hard to receive information from professionals who may not have experienced the same trials, the same worries, the same concerns, and the same life challenges that you have. And so coming together in this group setting allows for these mothers to be able to share openly what they're experiencing and then are able to grasp and gather additional information so that they can have working tools that will be implemented beyond our 8-week course. Also, I want to mention that we build an environment of sisterhood. And that is why social capital is so important. We teach our mothers that it is important that you understand that we live in an interdependent society. No one is really truly alone and doing things on their own. You have a support network. And while some support networks may not seem to be as strong, we teach mothers how to strengthen those support networks in order to improve their social capital. Even during group sessions, the mothers are able to guide and direct and support one another on information in terms of what's available in the city for community resources. And they're able to help other mothers problem solve when they are in the thick of some serious difficulties involving parenting, involving intimate relationships, and involving just being a mom in general. So today, you get an opportunity to have a sneak peek, which is exclusive, of our one class session called Fixing Unhelpful Thoughts. And so this is exclusive because only 10 of participants are able to enroll in our 8-week stress management course. Today, you will learn how depression and anxiety contributes to your mental behavioral storms. That is why we've named this session Surviving the Storms in Our Minds, because everyone experienced some sort of chaos in trying to disseminate what kinds of thoughts are helpful and what kinds of thoughts are unhelpful when we have to make decisions and when we have to progress in our lives. You're also going to learn what your personal storms look like and how it impacts your mood. Oftentimes our mood determines our action. And so what we want you to understand is that connection, the connection between the mind, the connection between the mood, and the connection between your motives. Then you're going to learn how to identify unhelpful thoughts and develop skills to fix them. We are a very motivated team who wants to inspire you to be able to use whatever it is that you grasp from this presentation. We want you to leave with tools that will equip you to solve your problems from now and beyond. Okay? So then finally, we are going to teach you survival strategies to calm your storms and to improve the messages you send to your children. Remember, we're talking about you, but we're also talking about your children because parenting is essential and stress management is essential as well. And marrying the two together, you're going to not only positively impact you and your mood and your mind and your behavior, but you're also going to impact those of your children because they are watching. And so you are modeling behavior. So let's talk about how depression shows up in families. Here are a list of common and very specific symptoms of depression. There's a sense of hopelessness, tearfulness, irritability, where people just seem so on edge, unexplained weight loss or weight gain, where they may lose or gain 25 to 30 pounds in a short period of time, aggression, insomnia, which is lack of sleep, hypersomnolence, which is too much sleep. We had one mom who graduated from our program, and at the graduation ceremony, she gave a testimony, and her statement was that she was asleep for an entire year. And upon joining the Moms Partnership Program, she was able to get out of bed, and she thanked us for feeling as if she had awakened. She said, "Thank you. This program helped me, and I am awake, and I finally am able to get out of bed, and now I am privy to my purpose." That touched our hearts because we knew that this work was going to be hard, but we didn't know how effective we would be and how it would turn into hard work. Suicidal ideation is also a symptom of depression, as well as apathy, which is lack of interest or motivation in engaging in activities that you once found pleasurable. This is how anxiety shows up in families. Have you ever had a moment where you felt like you needed a paper bag to just breathe in, right? You're like, oh my gosh. One of the symptoms of depression that I didn't put on here was like trembling, right? You're like, oh my goodness, right? Because you're overwhelmed. Okay, so worry, racing thoughts are a symptom of depression where you're thinking, oh my goodness, you can't sleep at night, difficulty concentrating, you're easily distracted, you experience fatigue, nausea, shallow breathing, and also your muscles become really, really tense. You may experience headaches. You may also experience heart palpitations where you feel like your chest is your heart is going to burst out of your chest, and then sweating where your palms get really, really, really moist, and then you form sweat beads on your forehead and underneath your arms, right? So those are symptoms of anxiety. And the reason that I'm talking to you about these depressive symptoms and these symptoms of anxiety is because these thoughts, these physiological experiences contribute to the storm that you have in your mind, and vice versa. It's both of them are impacted by one another. So it's like going back and forth. All right. So let's do some deep breathing exercises because I wanted to talk to you about how to be calm before your storm. And so let's shake out your arms. Because, yeah, we are doing this live because you need to know how effective this deep breathing skill is. Okay, this deep breathing technique is going to allow you to be able to calm down in the middle of difficult situations and help you make the best decision for you and your family when raised with the opportunity. Okay, so you shake out your arms, shake out your legs, relax your shoulders. Okay, now you're going to sit up in your chair. Place your feet flat on the floor and your hands in your lap. Now I want you to take a few breaths normally. Okay, now I want you to place one hand on your chest, the other hand on your belly. Close your eyes. Now take a deep breath in through your nose and out through your mouth. Now for 4 seconds, inhale in through your nose. 1, 2, 3, 4, and exhale through your mouth. 1, 2, 3, 4. Inhale through your nose. 1, 2, 3, 4. Exhale through your mouth. 1, 2, 3, 4. Inhale through your nose. 1, 2, 3, 4. And exhale through your mouth. 1, 2, 3, 4. Last time. Inhale through your nose. 1, 2, 3, 4. And exhale through your mouth. 1, 2, 3, and 4. Open your eyes. Release your hands. How do you feel? I feel calm. I feel cool and collected. And so some people may feel sleepy because you need more rest. And so if that's the case, you need to go to bed early tonight, okay? So now let's talk about 3 reasons why deep breathing works. The first reason is that it promotes calmness. So I feel good. Do you feel good? I hope you do. And so it also decreases high blood pressure. So when you get in those moments where you feel like your blood pressure is about to shoot through the roof, stop and practice your deep breathing technique. This really works. You can do this in the store. You can do this in the car. You can do this in the bathroom. You can do this anywhere, and you can teach it to your children as young as 2 years old. Why? Because you're going to be teaching them how to regulate their mood and how to make better choices when they feel like they're about to have a temper tantrum. Okay? All right.
Okay, now let's get into our activity today. So today we're going to be talking about what storm do you most identify with, you guys. So in the chat box, you're going to identify if you're 1, 2, or 3. Now I'm going to describe these storms to you. Are you ready? Okay, let's go. A blizzard is cold, distant, quiet, deceptive. It's like, when it's a snowstorm outside and you're stuck in the house and you can't go nowhere. You're stuck in that storm. And then you have your standstorm, which is aggressive, dismissive, impatient, explosive. And that's when you feel like everything is just happening and you don't have no control over, but you got to go out here and do the best you can. And then you have that tornado. It's chaotic, it's reckless, it's unpredictable, destructive, consuming. And you're just caught in a tornado and you can't go nowhere. You just have to deal with it. So I want you to put in that chat whether you're a 1, 2, or 3, and then we can just go on to discuss. We'll give you a few moments. Okay. Now, let me describe what kind of storm I am. I am a blizzard, y'all, because when I'm upset and I get anxious, I just get cold and distant and quiet. I don't want to talk to anybody. I don't want to talk about my problems. I just want to be in that blizzard.
And so, Sabrina, thank you so much for sharing what kind of mental storm you have when you are under stress and when you might be experiencing some sense of anxiety. The blizzard is very interesting because what happens is you allow unhelpful thoughts to pile up like inches of snow. And so while you're thinking, Oh my goodness, these people are so inconsiderate. Oh, they really don't care about me. I always knew they felt this way. And so you think about these thoughts until they pile up. And then while you are thinking about all these things, you're appearing on the outside as if everything is okay. That's that form of deception, right? And so while you're thinking about all these problems and you're thinking about how, for example, people are treating you, you're miserable on the inside, but on the outside, you are displaying a defense mechanism called internalization, where your attitude changes because of all that you've been absorbing, all of these thoughts in your mind. And then you decide, you know what, I'm going to suppress. I'm going to truly suppress how I feel. But that's another defense mechanism that people use to protect themselves. And they go into this self-preservation mode because oftentimes people who are blizzards, they don't want to tell people what's really happening. And they may not be comfortable with really sharing what's actually going on inside their minds for fear of how other people might respond. Also, another defense mechanism is one that you mentioned. You might become cold and distant. You might isolate yourself. And so that may be okay if you're by yourself, but it is not very effective or very positive when you are at home with your children, because oftentimes your children need you and they need your attention. And so if you shut down, you are not able to give them the stimulation and the attention that they may need at any given moment. All because you have all of these things going on in your mind that keeps your focus off of home or keeps your focus off of other more pressing matters. So, do we have any other identifying individuals who can connect with the other storms? Okay. Okay.
In our chat function, our participants are still being a little shy, but I think
Okay.
I can connect with the sandstorm from time to
Mm. Okay. So, in terms of having a mental sandstorm, whatever thoughts you're feeling, whatever conflict you're experiencing in your current environment, you would tend to take all of these feelings, all of the conflict, and then you would transfer them into another environment. Sandstorms do this. They collect all the dust, they collect all the rocks, and then whoosh, this whirlwind happens, and then it goes into another setting and another environment. And so, an example that I can use to kind of make this more realistic is, say, for example, you are the parent of a teenager, right? And you tell them repeatedly to clean their room, but you feel ignored and they don't comply. So then you decide, I'm going to call your grandmother because this is ridiculous. And so then you get on the phone and you say, Mom, right? You say, Mom, Terry is not listening. I done told them 4 to 5 times to clean his room, and he is just completely and utterly disrespectful. And then grandma says, not my baby. Put them on the phone. What are you doing? Why on earth? Why aren't you listening to your? And then everybody is in an uproar. Now all the other kids are coming in to see what's going on. And so you have this big old issue. And it's not just in your household. Now it's in grandma's household. So now aunties and uncles who were over there are now getting into the conversation. And so now there's this big old issue and mess. And your teenager is sitting there thinking, I'm not going to tell my mother anything because all she's going to do is run and tell all of our family members. She's going to put our business in the street. Okay. And so then that makes your child want to shut down. And that's not good because you want to have open and honest communication with your children. And so what you have just done as a sandstorm by bringing other people in, especially your family members, is you have then triangulated. You have then brought someone in as a manipulative tactic to get someone to do something that you wanted them to do. And so that is what sandstorms do. They may go out and they might tell everybody to get a response so that they can feel sided with, right? And so then now we are talking about that mental storm of tornado. Now, the tornado is when your thoughts are spiraling out of control. That's why the attributes are chaotic and destructive and consuming, right? Because you take and you take everything in, and then you lose control of your behavioral responses. Because in your mind, you're plotting, oh, how am I going to get this person back? Or, oh, I can't believe they did that. And so they are going to pay for it. So then you have this vindictiveness about you. Why? Because you cannot accept rejection, you can't accept disappointment, and you don't like to be put in a position where you don't feel like you are empowered. So you feel a little bit disempowered. And so as a tornado, you get the opportunity to learn how to control your impulses. But sometimes it is very difficult to have impulse control. And so that's why we're going to teach you a new skill set today. Also, with the tornado, you have consistent thought patterns that interrupt positive thought patterns. And so you begin to catastrophize, right? Every single event that happens to you. It could be that somebody accidentally knocked over your water and you're like, you meant to do that. You did this intentionally to try to ruin my papers. And the person, it may have just been an accident. And so this is why it's so important for us to not take things out of context, not explode or become reckless in our behavioral responses, because our children are ultimately impacted by it. And if you feel like you're in a difficult space where you can't control how you respond, then stop, do some deep breathing, and get connected with a trusting person that you feel safe with to say, hey, I need support on how to manage my behavior, how to manage my anger, what to do when I am completely and utterly stressed. So how does this mental storm impact your mood? Well, if you are a blizzard, then your mood would then, you might be down. You might feel as if, no one cares. You might feel like, I'm in this all by myself. I'm sad. And, the best thing to do for me is isolation, right? Now, if you are a sandstorm, then your mood, you may be frustrated. You may have a frustrated mood. And then if you are a tornado, then your mood is definitely anger. Mm-hmm. And so how does your storm impact the mood of your children? Because again, we're talking about fixing unhelpful thoughts while we are parenting. And so when we experience conflict among family, friends, work, other relationships, we experience these things that we then internalize, and then they are harbored, right? And so when we're harboring these thoughts, those are the perfect conditions for a storm to brew. And so then your children who watch every little thing that you do. Why? Because they have been connected to you since they've been in utero. Okay. And so they can feel what you're feeling. And so when your mood when you are displaying a mood that is frustrated, when you are saying that you're angry, when you're saying that you don't want to be bothered and you feel lonely, then your children are able to sense it and they're able to observe what you do in that moment. And so then you are then displaying a message. You are sharing a message with your child, whether verbal or nonverbal. And so your frustration could be you slamming things, right? And so then your children then learn, well, maybe this is a way to cope with stress. Because then your coping mechanisms are then transferred to your children, because why? They are little reflections of you. So you may feel lonely. And so then when your child is experiencing some sort of stress, because children do experience stress, then they may go and isolate. And you may say, why? What's wrong with you? Why are you separated from the rest of the family? But you may not be aware at the time that they're just doing what they've seen, modeling behavior. So let's talk about parenting and messaging. Parenting and messaging go hand in hand. Why? Because you are your child's first teacher. Maternal mental health is extremely important because if mommy is not okay, then the family is not okay. You are the lifeline. You are the one who holds everything together. You are the glue. Not only are you considered the co-protector in your family, you're also considered the co-provider. And so you set the mood, the tone for what your family dynamics is going to be. And so I would love for you to take a moment to think about the messages that you received as a child and how they shaped you and influenced you to become the person that you are today. Now, some of those thoughts will not be helpful. Some of those messages that you received will be unhelpful. And they still impact you and shape you and mold you. And they still bother you. And you still have some resentment about those messages too, to be quite honest. But today we're going to learn about how those unhelpful messages impacted you and then how you're going to turn it into a helpful message. Okay? So when I was young, I was told that I was super, super talkative. Super talkative to the point where my granddaddy, he used to call me motor mouth. Can you believe that? And so when I was in kindergarten, first, second grade, on my report card, right next to my grade, it can be that I had an A. And they would write, talks too much, right? Exclamation point. And that was so mean to me as a child because I was like, I mean, am I not supposed to socialize with my friends? And so then as I got older, right, I became a passive communicator where I suppressed my thoughts and my feelings and allowed other people's needs to go before my own. And so I would swallow what I wanted to say. And then people would say, why are you so passive? That didn't bother you? And I'd say, it's okay. But in reality, it wasn't okay. So then as I matured and I got around some really great people, they taught me how important my voice was. They taught me how important it was to get out what I was feeling, express myself, because I had some really good things to say. And they told me that I was insightful and that people needed to hear my thoughts and people needed to hear my experiences and that I would be able to be helpful in my community and in society and the global community as well. So then I started speaking up. And then when I began to speak, you guys, let me tell you, people were like, where have you been hiding? Can you come and speak at this venue? And it then propelled me into my purpose. I wouldn't be sitting here before you today if those people didn't turn that unhelpful message into a more helpful message. Now, my grandfather loved me so much, and he made it a joke. And so now I can say I'm proud to be a motor mouth. Because if it's going to help heal someone, if it's going to help change someone's life, if it's going to transform someone's thinking so that they can become the best version of themselves, then I will keep talking and talking and talking. So as long as they get these helpful messages and it sticks and it plants into their minds and the seed germinates and then it blossoms and blooms into something beautiful. So let's take a moment to think about you. What are some messages that you received as a child that were unhelpful? Now, what are some messages that now you want to take and you want to fix and change them into helpful messages? And so I'm going to teach you a defense mechanism really quick. It's called sublimation. You want to take that negative thing and you want to take it and express your frustration and your anger and you want to turn it into something positive. So for example, when you say, hey, you talk too much, guess what? I'm going to start me a talk show. Okay. When you say that I need to lose weight, guess what? Oh, I'm going to go hard. I'm going to go. And you said I'm fat. Oh no, when the next time you see me, I'm going to look so good and I'm going to be so healthy and your head is going to turn and you're going to do nothing but say, you look so good. I can't believe it. Right? So let's talk about the messages that our children receive from us, right? What are some unhelpful messages that you've told your children? Have you said that your children were bad? Did you refer to them as hyperactive? Did you say to your child that they that your child was annoying, those are unhelpful messages. Why? Because it seems as if, you don't like them as much. It makes it seem as if when you say they're bad, then that means that they can't do anything good. When you say that they are too hyperactive and they're all over the place, it makes it seem as though you don't know or you aren't capable of teaching them how to manage their behaviors. Because maybe they are, experiencing some impulse control and they need some support from you. It is time for us to be a little bit more compassionate and have a little bit more empathy with our children because they have a lot going on. And so do you. Why? Because we are now distance learning, right? We are in a space where we have the opportunity to shape and to mold our children into the best little us's. The best little versions of us that we can. I just made that word up, right? And so you want to take them and shine them up. So when the world opens back up fully and we're not in this pandemic, you reintroduce them in a manner that you can be proud of, right? And so it is important that all those unhelpful messages, you begin to turn them into helpful ones. And so in talking about messages that are helpful and unhelpful, let's talk about these unhelpful thoughts that lead to your storm so that you can then fix them, right? And so that your child can see how resilient you are when you're managing stress. And then they can look back and they can say, wow, my mommy was resilient. Wow, my daddy was resilient. And whenever they experienced any type of trouble, I knew that they were going to be okay. And so now I can be okay when I'm experiencing trouble and when I'm experiencing moments of difficulty.
Okay, let's go into the unhelpful thoughts that lead to your storm, y'all. So when unplanned events in your life happen, oftentimes your automatic thought becomes self-defeating and negative. This then triggers negative mood and patterns of behavior. So here are some examples. Are y'all with me? Okay, I quit. I don't want to do this today. I can't do it and I'm not going to do it. This is just too much for me to handle. I'm in a dark space. I can't wake up. I always make mistakes. Darn it, I missed my doctor's appointment. I don't care. My life has no meaning, so I'm not going to do anything about it. I'm not good enough. I give up. No one loves me. So these are the unhelpful thoughts that you may be having in your storm, but we're about to fix that. Okay, so how do we fix these unhelpful thoughts? Well, it's 5 steps to it. Are you ready? All right, let's go. First of all, you're going to stop the thought, interrupt the storm. So when you get that thought that you can't do this or it's negative, you have to immediately stop the thought and think of something good that you did today. Think of something positive. Just stop it. Like, you know how you have red, green. When you get that stoplight, you got to say, stop. I'm not doing it. You're going to go on green. You're not going to stop on red. Then you're going to replace that thought with a positive thought about your capabilities, what you have attempted to accomplish. And as we say in the mom's class, you got to be kind to yourself, because guess what? We all have to be kind to ourselves. We as mothers, we are nurses. We are the taxi drivers. We are now the lunch lady. They have to serve lunch, but we don't get paid for them services, do we, ladies? So guess what? You got to be kind to yourself. So an unhelpful thought you may be having is, I always make mistakes. That's okay. You know how you turn that into a helpful thought? You say, everyone makes mistakes. I try my best. Let me see what I can do to achieve my goal. The third thing is you want to identify the problem. How do you identify the problem? You do not make a big deal out of the problem. You don't just say, okay, well, this is a bigger problem than what it needs to be. You kind of make the problem work to your advantage. You make it be like, okay, this is what I'm going to do. This is how I'm feeling, and I'm going to minimize the problem. Don't make it something bigger than it is, okay? You attempt to fix the problem to the best of your ability or seek support, right? Now, when you do that, Seek support from family members, a group member. You can seek it from your best friend. Have a support system. In the DC Moms program, we definitely encourage people to have a support system. And it's so important. We all have a support system, whether we like it or not. You need someone to talk to, because when you have them days with your babies or your significant other, your husband, you need someone to talk to. And then 5, evaluate your mood. And when you evaluate your mood, you know how you wake up in the morning and you don't feel like taking a shower. It can be a rainy day. You're like, I don't feel like it today. You say, okay, but I'm gonna get up and do it. Evaluate your mood before you get up, and don't wait to evaluate. Don't wait to say, oh, I'm gonna have a bad day in the morning. Wait till the end of the day and then evaluate your mood, because by then you have done the things you need to do to solve the problem to the best of your ability and being kind to yourself. And then think about the messages you send to your children when you're in a crisis, as Ms. White said. Sometimes as parents, we just go off. And then your child may go to school and they may throw a tantrum and you're getting a call. Oh, you know, your child is acting out. And you're thinking to yourself, oh my, I shouldn't have acted out, because now they're doing the same behaviors you did. So it's always important to stay calm through your storm and turn that unhelpful thought into a helpful thought, a positive thought. And I encourage every one of you to do it who's listening today. Okay, messaging to send to your children while calming your storm. Are you ready? Okay, so let me give you some tips here. So let your children know to give you a few minutes to think and calm down. When your kids are getting on your nerves and you've done that virtual learning and you're at your last straw, you can say, baby, I need you to go upstairs for a minute. Mama need a break. You may need to go out in the porch. You may need to go to the store. You may need to lock the bathroom door and do some deep breathing, all right? And then number 2, take a moment and go into a room and practice deep breathing exercises, as I mentioned before. You can do it at night. And then you know what else you can do? You can do it with your children. Say, come on over here and breathe with me. You need to breathe together, because we're both going through the moment. We're going through a storm, and I need you to breathe with me. 3rd, practice fixing your unhelpful thoughts. So when you get those thoughts, practice every day. So it just becomes a norm in your life. You're not just having unhelpful thoughts. If something doesn't happen for you, guess what? There's a greater plan in store for you. It's not your business to know, but it's coming, because you know, guess what? Every storm has a positive rainbow at the end of the day. So when you are calm, return to your children and give them a hug or sense of affection. So, you know, our kids do things we don't like. They all do things. We're all doing virtual learning. Give your babies a hug. Tickle them and say, why you do that? You know I love you. And then give them all these kisses and embarrass them in front of their friends. They're going to be like, oh, Mom, don't do that. You're embarrassing me. I know you love me. So those are, you know, just show that positive affection. Give your kids positive boosting affirmations. You can say, I love you so much. You're super smart. You're gonna take care of Mama in that big mansion one day. You know, you can say, I appreciate how much you care for me. And you can say, you are such a sweetheart, and have a big hug. These are just some examples. You can have your own. One of the ones that I tell my children is, you can do it. You don't give up in anything they face. And I'm a mother of adult children, and I'm a mother of one minor child. So I'm always telling my kids, you can do whatever you put your mind to. Look at your mama. Your mom is a superstar. Okay? So that's the message I want to send out to you guys, because that's what I do as a CMHA every day. Okay? Now we're going to go over some practice, y'all. Y'all ready? So I want to get some of your thoughts that you can put in the chat when I ask you these 5 questions, but I'm going to give you a scenario first. So you have multiple school-age children who you will be supporting in distancing learning for 1 year. And I said 1 year. I ain't say 3 months. I said 1 whole year. You have a full-time job and other household responsibilities like doing the laundry. You are the taxi driver. You're the nurse. You are everything. You're the cook. Okay. And then all the teachers want you to submit class assignments on time, every deadline. So they want you to get online if you have technical difficulties. They want you to complete an assignment. They want you to help the child. They want you to do all these things, okay? What is your first thought? Can somebody put in the chat to me, what is your first thought? I'll give you a few moments. I can tell you what my first thought would be. I would be overwhelmed. I would be over here sweating like pigs in a blanket. Because I'd be like, oh my God, how am I going to do all this? My brain I can barely handle working 8 hours a day, much less doing this. And that's a whole full-time job. And then you got to fix, number 2, you fix that unhelpful thought, right? So you fix that unhelpful thought by saying, I am enough. I'm going to do the best I can here. If the child doesn't finish the assignment, well, I can turn it in tomorrow. I have a busy work schedule, and you can talk to the teachers. Those are helpful thoughts that you can have during this process, this time of virtual learning. You identify the problem. Again, don't make it into something bigger than what it is, because sometimes as moms, we just worry so much, and the kids be like, you tripping, it ain't that serious. And you'll be like, what? It is that serious. You got to turn in your assignment. What do you mean? But don't turn it into something big. You just say, look, I need you to finish your assignment, okay? How will you attempt to solve the problem? So you come up with solvable ideas. Don't try to be Superwoman, because we all try to be like Wonder Woman. We are not women. We don't have a magic lasso, okay? We don't have that. We only have ourselves and other fellow moms, okay? So try to come up with some suitable ideas. Don't try to be Superwoman. We're not that, ladies. We're human. What is your mood and message to your children? So what is your mood when you've done all this? You feel good at the end of the day, because guess what? You got through another day of homeschooling. We're in like the 3rd or 4th week of homeschooling, I want to say. So guess what, ladies? Congratulations. You got through it. Bravo. You got through it. We're all getting through it. So bravo to you. Know you're doing a good job. And the message to your children is you can do whatever you want to do. This is a stressful moment for everybody. It's everybody going through this. So I want you to practice, practice, practice. This is what we do in the moms class. This is just a little bit of what we do. And we have such positive, outlets with this, because we even had a class, and we were talking about virtual learning, and the parents came up with some tips, which I think were fabulous. And I'll just give you one. I can only give you one sneak preview. One of them is to make sure that your kids are ready for school the night before. Make their lunch. Make sure they have their computers turned on and for the night, so they can have a good day at class. And that's just one of them, preparing them for school, having them do their lunches. And if you want to know more, we are always here to help you. And that is what DC Moms is about. We're here to help moms who are transforming and going to the next journey, because their journey really begins when the 8-week course is over. We've just begun to do the work. And I hope that you got something out of unhelpful thoughts today. Okay, let's talk about reflections. How did you feel calming your storm today? And as you look at this picture, just look at that tree and look at the water. I know I love the ocean. I love any type of water, because it calms you down. It gives you that Zen feeling. So if somebody can put in the chat, if you woke up today and you knew you had to do all this stuff, talk about how you felt about your storm today. Did you feel like you can survive your mental storm moving forward and what we've taught you today? Describe how will your children respond to the storm today? I know it's early in the morning. You had your coffee, you had your good old breakfast, your oatmeal, because it's kind of chilly outside today. But again, just let us know what your storm is looking like in the reflection of it.
Thank you so much, Ms. Tate, for giving us really all these tools to put in our toolbox in order to fix unhelpful thoughts. Listen, unhelpful thoughts when we're in crises, unhelpful thoughts when we're in conflict, unhelpful thoughts overall lead to emotional struggles, which is why it is so important for us to focus on mental health and well-being, as well as a social support network. And so we want to leave you with a crisis response plan to deal with your mental storm. this could also be considered as your survival guide. And so we have a 7-step process to help you get into a place where you will be calmer. You can survive that mental storm because all storms pass. And you would then be able to feel better about how you responded to whatever situation you had to deal with, okay, or to address. All right. So the first step is deep breathing. You should have known. That is our go-to response. First thing you need to do, like for example, when there's a fire, you know to stop, drop, and roll, right? Okay, when you have a crisis that is causing you to have some emotional turmoil, you need to stop and do some deep breathing, okay? And so with deep breathing, you're allowing the oxygen to flow through your body and to your brain all the way throughout your bloodstream so that you can then be able to come up with better ideas, be able to calm yourself. And then guess what? Because moms set the tone, they set the atmosphere for how people will feel, right? You then get to shift the atmosphere and shift your mindset into one that is more productive. And then you kick into problem solving mode. All right. So then step 2, we're going to fix that unhelpful thought. Fix that unhelpful thought. Then you want to identify the problem. What is it that's ailing you? What is important right now? What is needed? How do you need to show up as the problem solver, the ultimate problem solver in your family? Step 4, you want to come up with 3 possible solutions to the problem. It is always good to have options so that when plan A doesn't work, you go to plan B and then you go to plan C. Right? Because there's not just one way to solve a problem. There's something called the law of equifinality. There is more than one way to skin a cat, okay? There is more than one way to solve a problem, in other words. And then step 5, you want to identify a support system, or you want to identify someone to help you solve the problem. As I mentioned, we are not alone. We are in this together. That's why when Ms. Tate mentioned that our moms came together to help us identify what are some helpful tips to get us prepared for distance learning so that we can have a successful school year. The moms all poured in and we said, okay, this is our plan. This is what we're going to do. And they all felt good about it. I know I did. And so then step 6, when calm enough, right? When your mental storm is dissipating, go to your children and show them affection. Let them know again that while mom may have been frustrated, while mom may have felt overwhelmed, while mom may have felt sad, that she was able to go get her moments and her thoughts, get her moment to herself, get her thoughts together, devise a plan to solve a problem, and then she was able to return, showing love, showing affection because she's resilient. And the same for dads as well. And then finally, step 7, you want to repeat deep breathing. Why? Because guess what? Sometimes when you're overwhelmed, you get headaches, you get eye pain, right? You get migraines, and sometimes you get chest pain. And so it's very, very essential for you to understand the physiological impact, which is positive, of the deep breathing exercise. So here's some next steps. Now that you have new skills, right, we want to make sure that you have some form of support. So now we're going to help you increase your social capital. Now, if you are in need of direct therapeutic support, you want to contact your state's or your jurisdiction's Department of Mental Health or your Department of Behavioral Health. You want to seek therapists that specialize in cognitive behavioral therapy, parenting, or who serve the maternal population. That's just a quick helpful tip in case you said, you know what, during this presentation, you said, you know what, I think I might need to talk to someone. Because everyone needs a safe space. And it may not always be with your friends, it may not always be with your family, but it may just need to be with a mental health professional where you can just vent and get some guidance. So, what can we answer? Do you have any questions for us in the chat?
So Ashley, I'm looking in the chat and we have some amazing questions. I'm not sure if we have time to answer them all, so let me throw one great one to you now.
Okay.
One question is how to work with your children when unhealthy messages have been fed to them from teachers, family members, or other children. These messages seem to be challenging to correct.
That's a very good question. So what you would do then is you would then ask your child, what are these messages? Where do they come from? And then you have an honest conversation with them about how that message is not something that you and your family support. It is not the foundation or belief system that you and your family have, and you continue to repeat it. This is why open and honest conversation with your children is so important, because you have to understand what the source is, and then you have to show up in a way where you're saying, okay, I'm here to educate you, I'm here to listen to you, I'm here to guide you. And so then you begin to undo some of those messages. You get to then allow your child to think critically and to question what those messages are, and then you can tell your child the intention of those messages. Say, for example, if a person says some profanity, right, and your child then picks it up, then you teach your child that profanity is not acceptable because it is not respectful language.
So model the behavior. Perfect.
Model the behavior.
We have additional questions, but let's ask the question that everyone wants to know.
Okay.
How can people be a part of DHS's DC Moms program?
Oh, yes. So DHS, the Department of Human Services Economic Security Administration, only allows moms who are receiving TANF benefits to be eligible for the program. So the way that we determine eligibility is that you must be receiving TANF benefits, you must be a parent that is 18 years of age or older, and your child must be living with you in the home. You also must be experiencing some emotional struggles. And the way that you can get in contact with us is by simply sending an interest email at dcmoms@dc.gov.
Perfect. I think you've answered all our questions.
Wonderful. Thank you so much for having us today. It has just been such a pleasure to be able to join you. Here's our contact information if you wish to learn more about the DC Moms Partnership Program and about the DC Department of Human Services programming and two-generation approach. We hope you enjoy the rest of the summit. Take great care.
Enjoy the rest of your day.
Thank you.
There is a major crisis with America's health system. Millions of people, including many with health insurance, are unable to get the care they need. The solution is simple. Having access to reliable, high-quality healthcare is the way to keep people and communities healthy.
That is why 30 years ago, we created Mary Center, because we believe that everyone should have access to the best possible healthcare, regardless of their ability to pay. For us, quality care is not a service. It's a human right.
For Mary Center, quality care goes beyond just medical care. It includes access to the very best in dental, behavioral health services, low-cost pharmaceuticals, education, and social services. We believe healthy people make healthier communities. So we've decided to refresh our look to show that by connecting each person to the best possible care, we will not only improve lives, but we will strengthen communities too, one person at a time. When Mary Center puts care at the core, you can too. To schedule an appointment or find out how you can help, visit our centers or go online at marycenter.org.
This is a vaccination to keep you healthy. You don't want the measles, do you? Here's your sticker.
Protect your loved ones and they'll pass it on. Don't let COVID-19 stop you from protecting your child.
You're next, Mr. Bear. You need a flu shot.
Now more than ever, it's important your child receives their vaccines on time. Brought to you by the District of Columbia Department of Health.
Ah, good. See, it wasn't that bad.
Do you worry your preschooler doesn't walk, talk, draw, or play like other children their age? The Early Stages Center can help. Our friendly staff will assess your child's development through one-on-one, play-based activities. Early Stages will then connect your family with the educational services that are right for you. Everything is free, whether your child is in public school, private school, or not yet enrolled in school. Call 202-698-8037, a service of the DC Public Schools.
This is a total no judgment zone. We don't want parents to feel like because of X decision that they've made, that they've done something the wrong way, because I know how sometimes difficult it is to manage diet and brushing. So it's important to put families at ease, encourage instead of discouraging, and making sure that they know that we are partners in their care, and not those that are there just to wag a finger or judge them about anything that they're doing. To get a call from a parent that says, I cannot breastfeed my child because of you. Maybe they've been told elsewhere they'll never breastfeed their kid, and a simple procedure to do something now changes that whole trajectory for them. Or a child that may have been referred to me and no one can do anything with them, and they come in and I'm going, really? The kid walked in and out smiling, like we had a ball. And we didn't have to do anything like sedation or general anesthesia, which we do pretty often, for them. We didn't even have to do that. A simple, just encouraging, it's gonna be okay, we've got this, we're gonna do it together, let me know what you need. Just kind of thinking about families and thinking about my own family as we make decisions within our practice.
Listen, every day in America, workers are forced to make the unthinkable choice between caring for themselves and loved ones or keeping their job. You know how that can be. Beginning July 1st, 2020, workers in the District of Columbia will be eligible for paid family leave. That's right. When your loved ones need you most, you should be able to step up to the plate and take care of them. That's why DC Paid Family Leave will provide up to 8 weeks of parental leave to bond with a new child, 6 weeks of family leave to care for a sick family member, and 2 weeks of medical leave to care for yourself when facing a serious health condition. Hey, we understand that sometimes life happens, and you shouldn't have to choose between your livelihood and your loved ones. So if you want to learn more about DC Paid Family Leave, check it out at dcpaidfamilyleave.dc.gov.
Complete the 2020 U.S. Census. It is safe and secure. It benefits your city, your community, and your family. When you fill it out, you will help determine where billions of dollars will go, funding our kids' education, school breakfast and lunches, healthcare and Medicaid for our seniors, better social services, creating more affordable housing, job training, and helping everyone have access to food. Complete the census online, over the phone, or once you receive it in the mail. You matter. Get counted. 2020census.gov.
is we've been able to really shift our care according to what we feel like the population needs. I think one of the things that makes us strong is that we provide culturally aware care. I think it helps that the majority of our midwives are of color. When we're talking about birth disparities, especially with African American women, I think that we are now entertaining the conversation about years of generational distrust with a lot of healthcare systems. And so I think that we create a safe space for that interaction, not only by having more staff of color, but also just things like our late policy. Midwives, we see our patients regardless if they're late. We see pregnant patients late and we see babies late.
Our whole family is just tied up into Community of Hope.
Hi, I'm Heidi Murkoff, author of What to Expect When You're Expecting, and you may have heard moms matter to me a lot. That's why I founded the What to Expect Project and why I'm here to support Mayor Bowser's National Maternal and Infant Health Summit, because every mom should matter. I always say motherhood is the ultimate sisterhood, that no matter where she lives, her cultural, socioeconomic, political profile, the color of her skin, every mom shares a common goal. Every mom wants the best for herself and her baby. But far too many moms, especially Black moms, don't receive the quality, respectful prenatal care they need and deserve. Too many Black moms die of complications of pregnancy and childbirth, and far too many of those deaths are preventable. And the onset of COVID-19 has increased the risk for Black moms. Gaps are widening as clinics and hospitals in rural and urban areas close, and care becomes even less accessible, and more of our most vulnerable moms I speak to every day, are falling through the cracks of care. The truth is we can take care of our moms and control pandemic at the same time. We just have to pick our healthcare priorities, and we have to stop always putting Black moms last, like they don't even matter. One way we can do that by voting. This year, whattoexpect.com, a home to over 19.6 million moms, and the What to Expect Project have launched #MomTheVote to urge moms to speak up and be heard, to vote for those who vote for them, for maternal health care that doesn't discriminate or come with a use-by date, and that isn't paused because of a pandemic, for paid family leave that allows moms to care for themselves and their babies instead of forcing them back to work after only a week or two, affordable childcare, and so many other policies that impact their lives and their children's futures, and that of their mom sisters. There's no better investment in our future than the health and well-being of our moms, all of our moms, no exceptions, no disparities. Let's stop failing our moms. Let's make moms the priority they should be.
I'm Polly Donaldson, Director of DC's Department of Housing and Community Development. and I wanted to talk about affordable housing in the District of Columbia and our affordability crisis. The rule of thumb is you should only spend about a third of your income on your housing needs. We know we have to do more in the District of Columbia.
Mayor Bowser has been a national leader in affordable housing policies and funding, but she realizes we need to do more. So she challenged the city to produce 36,000 housing units by 2025, with 12,000 affordable to low-income residents. Our first analysis is looking at where affordable housing is across the city and where it should be in the future. This summer, we asked residents to examine a map of affordable housing in the city.
I feel the distribution of affordable housing in the city could be a lot better. It seems too much of it is concentrated east of the river in Ward 7 and 8, and not enough of it in Ward 3. Ward 3 would be a perfect place to have more affordable housing. It's resource rich.
For me, housing and affordable housing is personal. I first got involved in producing affordable housing for our homeless families over 30 years ago. To me, it's all about who is your neighbor, and are we able to say that anybody who wants to be in the district, whether you've been here for 5 generations or for 5 minutes, there is a place for you in the District of Columbia.
Clara is our first child, and we didn't know what to expect being first-time parents. And it's just been such a fun experience to watch her grow. Starting out very early, we monitored Clara's development using the Learn the Signs Act Early checklist. It was just an amazing resource to be able to say, okay, this is what she should be doing at this age. And it calmed our fears a little bit.
I would have to say my favorite resource of the Learn the Signs Act Early would be the app. But having the app readily available has honestly been great. And it's been awesome just seeing her development and growth. The Learn the Signs Act Early app is actually very easy to use. I can access it right there on my phone. And whenever my mind kind of pops to it, I can open it up.
I think I am a Learn the Signs Act Early super user. The Learn the Signs Act Early materials have been invaluable to me because I feel like they've been there with me throughout parenthood in kind of the way that a wise old friend might be.
Using Learn the Signs Act Early has helped me monitor my daughter's development and gives me a great peace of mind that the information is accurate and it's backed by science. It's fun to see when she achieves a milestone. I feel very proud for her and excited.
And it's not just a milestone of, is my child doing this next thing? It's what should I be working with my child next? Because that can be a big question mark as a first-time parent.
I want to know if maybe she's lagging farther behind than she really should, and that's something to bring up with our pediatrician.
Having something at my fingertips to kind of go through it with her physician. She's hitting these milestones, but not these other milestones. Should I be concerned? What kinds of things can I do to bring her up to speed? And then taking that and translating it with her teachers in her classroom to make sure these are the things I would like to focus on, and how can we work together to make sure that she's developing appropriately.
The Learn the Signs Act Early resources empower parents to take a stake in tracking their child's developmental milestones.
COVID-19 and its unique effects on infants and children as vulnerable populations, hosted by Children's National Hospital and the District of Columbia chapter of the American Academy of Pediatrics.
Good morning. My name is Dr. Lenore Jarvis, and I am the president of the DC chapter of the American Academy of Pediatrics. We're very happy to be here with you today. The DC AAP is the Washington chapter of a national organization of over 68,000 pediatricians. Our chapter alone has over 470 members of pediatricians from all over the district. I am also a pediatric emergency medicine physician at Children's National Hospital. We're here today because during COVID, many groups have been disproportionately affected and vulnerable. Children or pediatricians have noticed this as well. There are many special pediatric considerations, and we know that children during this pandemic need to be continued to be linked with quality physical health and mental health care. This session today will outline strategies for identification and response to COVID-related pediatric concerns and create next steps for future areas of growth and response to child health needs within the district. I'd like to take this time now to introduce some of our other panelists, the executive committee members of the DC chapter of the AAP. Let's start with Dr. Nia Bodrick.
Good morning, everyone. My name is Nia Bodrick, and I'm a board certified pediatrician here in Washington, DC. I currently serve as the vice president of the DC chapter of the American Academy of Pediatrics, and I'm also a pediatrician at Children's National Hospital at the ARC in Ward 8.
Thank you, Dr. Bodrick. Dr. Cornejo?
Good morning. My name is Christian Cornejo. I am also a pediatrician. I'm the current treasurer for the DC AAP chapter, and I work at Mary Center, a federally qualified health center in the Washington, Maryland area.
Thanks. And Dr. Gil Bailey.
Hello, good morning. My name is Carmen Gil Bailey. I currently serve as the secretary of the DC chapter of the American Academy of Pediatrics. I am also a pediatrician. I work as a pediatric hospitalist with Children's National, but also serve as the executive director of Children's School Services, providing health services to the schools with DCPS and some of the public charters. Very glad to be here.
Thanks, Dr. Gil Bailey. So briefly, the format, the main three things that we're going to talk about with you today in a question and answer format are physical health concerns for children in COVID, mental health concerns, and school-related questions and concerns. We will leave time at the end for audience question and answer, so please, throughout the panel, as your questions come up, put them in, and we're happy to address them at the end. As a reminder, resources can be found on the DC AAP website under the COVID section, aapdc.org, and that's /COVID-19-resources. But if you remember aapdc.org, it'll get you there. All right, let's go ahead and get started. The first question is for Dr. Bodrick. Are you noticing in the COVID pandemic that children are coming to pediatric clinics for either sick visits or their well child checks?
Sure. So fortunately, in the past couple of months where I practice, we have seen an increase of children that are coming in for in-person well child visits and non-emergent sick visits. And there are a number of practices who are also offering telemedicine or video visits for families as a way to increase access to care. And so I just like to emphasize that, most practices in the district and across the nation are putting in measures to make it safe for families to come in person.
Great. And Dr. Cornejo, we've noticed that a lot of families probably appropriately have fears surrounding coming to in-person visits for pediatric visits. What are some of the fears that you're noticing, and what are pediatricians doing to help families feel better?
Well, the main fear, of course, is related to getting sick. Not only that, but also to make our loved ones sick. So what we are doing in the clinic is we're doing different things. We are, as Dr. Broderick was mentioning, we switch a lot to telehealth appointments, and that allows for a lot of communication that we can have with patients, and there's a lot of things that we can do with that. Some of our clinics have changed the way how they work in terms of having only well exams in the morning and sick visits in the afternoon. That allows for not being around patients who are sick. Some of our clinics also are doing a lot of screening before they come to the clinic. Some of us are taking temperatures, not only to the patient, but to the family. We're going through some screening questions. If somebody has been sick with COVID in the family, I have fever, runny nose, and then we are acting to that. One of the things that we're trying to do in the clinics is just trying to kind of follow the CDC directions in terms of trying to keep the distance in the clinic. We're trying to make sure that we are cleaning all the areas where we can have potentially patients. We're asking our parents to stay in the cars as much as possible. We are also actually doing some of the visits in the car, when that allows us to do that. So those are one of the things that we are doing in the clinics.
Dr. Bodrick, another question for you. Who in COVID should get tested and how do they get tested?
Sure. So that's a good question. It doesn't have a very simple answer, but my recommendation would be that any person who is showing signs or symptoms of COVID-19 should contact their healthcare provider or their primary care doctor first. As many of you know, signs and symptoms can include cough, shortness of breath, chest pain, fever, a new loss of taste or smell, chills, nausea, vomiting, diarrhea. So if you're having any of these symptoms, I will call your primary care doctor first. And every practice is triaging families in different ways to decide whether or not it's appropriate for you to get tested. Also in the district for children 6 and over, you can also get tested at a number of community sites, and you can go to coronavirus.dc.gov and figure out where you can get tested. But I would just caution that regardless of wherever you get tested, whether it's at your doctor's office or at a community site, you should quarantine or stay at home until you get the results back.
Thank you, Dr. Bodrick. Dr. Gil-Bailey, I think many of us have heard about racial health inequities that have happened during COVID. I certainly think that that is true of pediatrics as well. Would you care to comment on that?
Sure, absolutely. I think it's an important thing for us to take a moment to discuss. As you described, there certainly are racial disparities in the impact, the morbidity, the mortality among patients and people, communities suffering with COVID, such that we see greater sort of complications, concerns, issues, death among Brown and Black communities who are infected with COVID. That does sort of translate out and translate down to the pediatric population for the simple reason that unfortunately there are health disparities that persist, and that those health disparities are very much associated with the issues that we're talking about more and more now, which have to do with institutionalized and systemic racism in the very institutions that all of us work within. In our field, we're looking at healthcare. And so, if we take the example of a older adult person who has diabetes, and we already know that there is more diabetes among Brown and Black communities, again, for some of the reasons that we've mentioned, having to do with access to care and issues around the types and quality of healthcare available. Well, when you layer on top something like COVID, you see that the diabetes is going to increase the complications from COVID, and therefore you end up with greater complexity, morbidity, mortality, as I mentioned, in that population. And certainly when we think about pediatrics, we think about, children that have perhaps some complex health conditions. How well are we reaching them? And is our system ensuring that parts of our community that are otherwise under-resourced are having the same opportunities at care to help mitigate the complication of COVID on top of their health complexities, and to assure that they have the needed access, et cetera.
Thank you, Dr. Gil-Bailey. In the interest of time, I do want to state that the www.coronavirusdc.gov is an excellent resource, and the DC AAP website, again, aapdc.org, is another COVID-related resource. Are there any other, this question is for all of the panelists, any other resources or future areas of growth that you might state are important at this time?
So I would just offer that this is an excellent time for us to really capitalize on the opportunities for collaboration. So, I work in school health, and as I work with my partners and colleagues in primary care, we're looking for opportunities to help connect families to services, to the physicals that they need, to the immunizations that they need. And I know we may talk about that later, but just looking at new and innovative ways to connect families to their health service, whether it's a mobile van or assisting with scheduling in a walk-up clinic or drive-up clinic that one of the primary care clinics is offering, I think is consistent with the kinds of approaches that help us overcome the great complexity that COVID has added to the healthcare landscape.
I think that's an excellent point, Dr. Gill-Bailey. And actually, you bring up immunizations. Why don't we transition to the topic of immunizations? I'll ask this question of Dr. Cornejo and Dr. Bodrick. Dr. Cornejo first. I have been told that immunization rates are decreasing in COVID. Can you tell me a little bit about what you're seeing and why pediatricians are concerned?
Yeah, as all of you guys know, we closed our clinics. We limited the presence of our patients because we wanted them to be at home. So that affected, the primary care services that we provide. That includes vaccines. So yes, definitely, there has been impact on the vaccines that we have been providing to patients. Now, at the same time, we're trying to catch up, and we are kind of reopening, and we are providing more services to our patients as vaccines are very important. It's very safe to return to pediatric provider, your pediatrician, to get your vaccines. We definitely don't want diseases that can prevent it, like measles, mumps, pertussis, etc. So please go to your pediatrician to get your vaccines. And now that flu season is coming, more reasons to get the vaccines.
Yes, I echo Dr. Cornejo. Please get have your child come in and get caught up on their vaccines. Flu season is here. We recommend that all children, unless there's a contraindication, 6 months and older, get vaccinated against the flu every year. And practices around the district are being creative in reaching out to families. We have here at the ARC, we have a mobile van, so families can come and drive through or walk up and get their vaccines. Some practices are extending their hours. Others are actually reaching directly out to families to let them know that they need to get caught up on their vaccines. So like we've just been saying, for the most part, your primary care home is where you should be getting your vaccines, and we're making every effort to make sure that it's safe.
Great, thank you. Dr. Gill-Bailey, what are some of the conversations that the schools are having surrounding immunizations? I've heard of no shots, no schools. I don't know if you want to talk at all about that.
Sure, absolutely. We are very excited about sort of the focus and commitment on immunization compliance across the schools and with children attending school for many of the reasons that Dr. Cornejo and Dr. Bodrick outlined. In the school setting, that is a place certainly where children are going to congregate, and once in-person learning resumes, if we are to consider that substantial proportions of the population of children in the school have not been appropriately vaccinated, then in addition to COVID, all the respiratory symptoms and complications and challenges that poses, we are potentially looking at the outbreak of a vaccine preventable disease like measles. And we can imagine the crisis that would pose to the community, but certainly the school environment itself in terms of not being able to continue learning and the likelihood of schools really thinking about whether they can continue in-person learning and having to shut down all over again. Not to mention that there are students and children and adults within our community that are very vulnerable, and a vaccine preventable outbreak like measles could be really devastating for them. So there's certainly the public health reason, and there's the individual health reason and community health reasons why vaccines are so important. In the school health setting, we are partnering with educators to reach out to families, alert them when their children are are due for a vaccine, overdue for a vaccine, are not compliant with the vaccine schedule. It's a partnership, and collaboration with our school leaders to make sure families have every opportunity to get vaccines before school starts. Now, we've already begun virtual learning, but this will become even more important when in-person learning resumes for much of the DC school community and other school communities in this region. So that outreach also extends to primary care providers and the care coordination that we do with families to help connect them to the available clinics, services, federally qualified healthcare centers, in addition to great services already in place. We're hopeful that children return to school with the vaccine compliance that helps prevent the types of infections in this community that we all live and work in.
Thank you. And I actually just want to add a point here. You mentioned the importance of these vaccines and the flu vaccine. I think this is a very unique time for pediatricians where if there are diseases that we can prevent, especially diseases that cause fever, like the flu, it's going to be very confusing for us in the upcoming months to know if a child coming in with a high fever is influenza or the flu or COVID. And so anything we can do to prevent children from getting sick with a fever, I think is going to be very beneficial. So let's move on to another kind of portion of physical health that was a secondary consequence of a lot of our in-person learning shutting down. So we've noticed in COVID that a lot of our children were receiving many meals from in-person school learning. So Dr. Cornejo, this question's for you, but for children and families who are experiencing food insecurity, and now that schools have shut down, maybe that made some of their meals a little bit more uncertain during COVID times, how are pediatricians addressing some of this food insecurity?
Thank you for that question, Dr. Jarvis. I just want to start defining what is food insecurity. Is it limited or uncertain access to enough food? Before COVID, one out of 6 kids were living in a household where there was food insecurity. And as you know, nutrition will impact their brain development, their ability to learn of our patients. It's well known that patients who had food insecurity in their homes will get sicker more often. It will take longer for them to recover from the illness, and will they stay longer in the hospital. So the way how we are addressing food insecurity in our clinics has 3 prongs. The first one is related to screening. We have to make sure that we are asking our patients for food insecurity. The second one, it is related to providing the resources for our patients to get enough food. We're talking about referring to WIC, SNAP, other organizations in the community. And the third one is related to supporting national and local policies that increase access to adequate health food for children and other families. So that's what we are doing.
Thanks. And Dr. Gil Bailey, can you tell me what role schools are playing in food insecurity?
Absolutely. So we should begin by sharing that, as most of you know, prior to COVID and before moving to virtual learning, the schools did provide meals to many students who were vulnerable and in need and were encountering food insecurity, and that was a vital part of a child's preparation for their school day, their readiness to learn. And certainly as a pediatrician, for the reasons that Dr. Cornejo have mentioned, is critical to maintaining health and wellness. And so now that we have moved into virtual learning, we have been very pleased and very excited to see that schools continue to answer the call as it relates to the need for families to continue to secure nutritious food for their families. And so schools have identified food sites where families can come to obtain nutritious meals that support their families, during virtual learning. And so this is something that the Public Charter School Board and DCPS have both committed to. I cannot recite the website right now, but would share and encourage that those of you that are joining us today, go to our DC AAP website where you can see the link that can take you directly to the information about where the sites are within the city, so that if that's a need, you can be connected to that resource.
Thank you. And to that point, I know that in addition to some of the school sites that are offering free and reduced lunches with meal pickups, there are some other resources throughout the city, nonprofit organizations such as Martha's Table, DC Greens, Capital Area Food Bank, to name a few. Does anyone else, any of the panelists, want to comment on other resources that are available?
One of the things that I'm doing actually is, and we are, I guess, very blessed at the Mary Center that we have a social worker that kind of help us to connect patients to the different resources, not only related to food insecurity, but inability to pay rent and electricity and so forth. So for those who can access a social worker, social services, that's a good resource in general for this type of things.
Thanks, Dr. Cornejo. Dr. Bodrick, there is a very diverse audience watching this today. I know that there are folks on this call who are watching that are also family-facing organizations, even if they're not in healthcare. Do you have any recommendations for how family-facing organizations could best meet their client or family child need when it comes to food insecurity?
Thank you, Dr. Jarvis. Yeah, I think Dr. Cornejo did a great job of outlining the ways in which organizations can reach out to families who may be food insecure. And we know that households with children are more likely to be food insecure. And so I think just routinely asking those questions, those hunger vital sign questions, the 2 questions of if they've had enough food that will last them to the end of the month, or if they, go throughout a month and their food doesn't last, and just connecting them to resources, because what we know is that families that were food insecure prior to the pandemic are going to be, continue to be food insecure. And we also have new families who maybe this is the first time that they are food insecure. And in the district, there are disproportionate amounts of African Americans, especially in Ward 7 and 8 east of the river, who are food insecure. And as Dr. Gil Bailey mentioned earlier, these inequities are rooted in lots of things. It's not a simple answer, but that includes institutional racism, lack of access to quality foods. There's only 1 full service grocery store in Ward 8, only 2 in Ward 7. And so this is prior to the pandemic. And so then the pandemic hits, and those issues are only going to be exacerbated. And so what we are trying to do at my practice is just normalize it. And we ask those questions just like we ask any other questions about the family's health. And then, connecting them to resources, and also connecting new families to federal programs like SNAP and WIC.
Thank you. Some of these topics are tied together. We're going to transition to another physical health topic that includes child abuse and increases of, underreporting of child abuse in COVID, and concerns for increases of domestic violence or intimate partner violence in COVID. I want to speak to this just very briefly. As an emergency department physician, we see unfortunately, a lot of this coming through our doors, and speaking with our CFSA partners, our Child Family Service Agency partners, I have been told that before COVID, about 20% of the calls that they received about child abuse were coming from the schools, and that 10% were coming from healthcare professionals and about 5% were coming from mental health professionals. And there is a deep concern that now that we're in COVID, we're not hearing about child abuse. It's not being reported as often because the means of which we report it are these in-person encounters within the schools, within the pediatrician visits, and within mental health visits. Another thing that we have noticed is that some of our child abuse hotlines and sexual assault hotline calls have actually increased. And I just want to state that from the National Sexual Assault Hotline, 67% of the calls since March have been perpetuated by a family member, and 79% are currently living with their perpetrator. And so this is just something that we feel very strongly needs to be considered and addressed, that, you know, our children are not slipping through the cracks, and that you know, as a community, we're thinking about child abuse, sexual assault, and intimate partner violence within our homes. The last thing I'll say is, you know, in the emergency department, although we may have seen a decrease in overall number of cases of child abuse and sexual assault, the cases that we have seen have been more severe, meaning that they're much worse in nature than what we were seeing before COVID. And just because there are fewer cases, it doesn't mean that we don't think those cases are happening. It just means we think that they're being underreported. So this question is for everybody, but starting with Dr. Bodrick, what are you seeing in your clinic, and what do you think are some of the best ways that we can reach out to children?
Thank you, Dr. Jarvis. Yes, underreporting is a major concern for pediatricians and really for anyone that works directly with children, especially during the pandemic, because there just aren't as many eyes on children in various settings, including our most vulnerable children. And so, you know, like I said, in the past month or two, we're starting to see more inpatient visits, which is great. But some of these are telemedicine visits, so we're not able to do a complete physical exam or have that that person-to-person interaction with our families. And so my approach has just been to have conversations with families. You know, we're living through a very stressful time right now, and it's okay for us as pediatricians or as child health providers to express that and just ask families how they're doing. And so I just ask, you know, the children, how is virtual school? You know, do you have a laptop? Are you able to connect to the internet? Any concerns with that? I ask the parents, you know, are you still working? Because some parents are unemployed now. And if they are working, are you working from home? What's it like working from home with your kids also at home? And we've noticed an uptick in just behavior change because this is a very stressful time. And so we talk about behavior with children. How do you handle when children, are not behaving in the normal fashion or quote unquote, acting out? And we just kind of talk through and problem solve and talk about these stressors as a way to prevent, you know, some of the issues that may lead to child abuse and neglect. And fortunately, we as pediatricians are able to link families to services if they need it.
Dr. Cornejo or Dr. Gil Bailey, do you have anything to add?
I would just offer that, the point you made, Dr. Jarvis, around the way that reporting would come in before COVID, and that 20% of that reporting would occur in the school setting is very concerning for those of us that work in school health, because it's the school health personnel in the school that very often was identifying a student that was unfortunately being abused, or at least had some stigmata or signs suggesting abuse. And that was the first step, if you will, to ensure that that child was safe. So in the absence of that, I think we realize that it's everyone's responsibility. If you work with children, you're a niece and you have a niece and nephew, you're an aunt or uncle, whatever your interaction or intersection is with children, we all need to sort of have an eye out looking for and considering whether, something as horrible as this is actually taking place, and go ahead and make the phone calls if needed. And, those numbers are available pretty much everywhere, but I guess I just want to emphasize that it's everyone's responsibility to take care of children and ensure their safety. Pediatricians are going to do their part. We in school health, although working with teachers and educators in that virtual environment, are also thinking about how do we support teachers in doing some health and wellness screening, or offering some services even remotely to help understand what's happening with students, what kind of stressors are they encountering, and is there in fact an element of abuse taking place in the home, and what kinds of things are we looking for even if in that remote situation. It's sort of new territory for all of us, but I think because of what is at risk, it's worth considering innovative and new ways to sort of capture this percentage that we're not able to capture now that we're not in in-person learning.
I think those are some great points. You know, I really appreciate the breaking down the silos, and you know, that if you see something, it sounds cheesy, but if you see something, say something. Anybody can report a concern for child abuse or sexual assault. The number for DC CFSA is 202-671-5683. You know, things you might notice are signs of injury that don't make sense, maybe some pattern bruising, or, you know, similar to what Dr. Bodrick was saying, you know, concerns for a difference in child affect, or maybe the child is saying something to you that is concerning, that certainly should be reported. And then I think, you know, Dr. Bodrick also mentioned the increased stress of COVID, and I think that's across the board for everybody, but certainly financial concerns, potentially being at home, you know, for longer durations of time with a abuser. And so the last kind of thing I'll state here is that if you are in immediate danger, call 911. But if you need confidential help for intimate partner violence 24/7, you can call the National Domestic Violence Hotline at 1-800-799-SAFE. And those resources are also available on the DC AAP website, aapdc.org. I'd like to transition now, mostly in the interest of time, we've talked a lot about physical health, but I think just as important, or maybe even sometimes more so important consideration in COVID is mental health concerns. So I was surprised to hear recently from someone that just assumed that children's mental health has probably improved during COVID because they're not in-person learning, and so they're not getting bullied as much. And you know, I can tell you firsthand, and I'll open it up to the panelists here, but that in fact is not always what we are actually seeing. So I'll start this question to Dr. Cornejo, but what are some of the mental health concerns that you've seen among your patient population?
Yeah, I mean, besides the physical impact of COVID, definitely COVID has impacted the mental health of our patients. Kids can be overwhelmed by stressful situations, especially by traumatic events. And I think that COVID-19 is a traumatic event. Patients will express, when they can, older kids will express anxiety, fear, will express sadness. Kids who are a little younger will express emotional distress in different ways. They will, have behavioral changes. They will have problems sleeping, sometimes refusing to eat. The famous "my tummy hurt," and those are signs kind of guide pediatricians to start asking about what's happening with them, what's happening at home, how are parents feeling. COVID-19 has disrupted everything, has disrupted routine, has disrupted school, vacation plans. You just cannot go to eat ice cream as you used to. So all these create emotional distress in our patients. So that's what I wanted to mention that.
Sure, and Dr. Gil-Bailey, Dr. Baldrick, do you have anything to add?
I was just going to offer that in addition to what Dr. Cornejo was describing from a developmental point of view for younger children, very often when they're encountering stress and traumas, you can see a regression in developmental milestones that they otherwise had achieved. So that can sometimes be an indication that they are really struggling with the general disorder that's happening across the world. We know that schools serve so many purposes, but one of them is that it tends to be a very ordered, routine, experience for children, that children really do thrive with order and routine. And so if there are opportunities, even as you're setting up virtual learning, to figure out how to make it sort of more of a routine for them, something that they can look to and be comforted by because they kind of know what to expect, that may be something that is useful and helpful. I think we also have to think about the grief and loss that families and children are impacted by. So many children, especially children in certain parts of our community, Ward 7 and 8, parts of even 5 and 6, where we have a lot of Brown and Black communities, there's been a lot of loss. There's been a lot of death from COVID, and that is traumatizing in and of itself. There's the element of grief and loss, and we need to think about the impact that that has with children and reach out to our provider community, pediatricians, even our behavioral health partners and experts, to better understand how to help children cope. One of the things that we know about trauma is that in addition to children encountering it, the way to help them recover from it or bounce back, if you will, is to look at the assets in their life and ensure that they're supportive adults, that they have the feeling of being understood and loved. And so looking at where are the assets and supports in the family and how can those things help in the family or community, but how can those things help a child really become resilient in the setting of what has just been so complicated, difficult, traumatic? I think is worth mentioning. Thanks, Dr. Jarvis.
Yeah, I couldn't agree more. I would just echo, what everyone has said, in that COVID-19, this pandemic, is a traumatic event or an adverse childhood experience, and so, my suggestion is just to create positive childhood experiences wherever you can. And if that means that you are going on a nature walk or having a FaceTime with grandma, or doing some socially distanced activity outside. And the routine also is very important. I can't echo enough how important that is to creating a sense of safety and security for children, having that routine, and that routine has changed, and it may continue to change. And so just being adaptable and really, encouraging as many positive experiences as you can in your day-to-day life.
Yeah, and if I can add something else, so just talk to your kids, ask them, what have you heard about COVID? What do you know about it? I think that's the best way to really measure how they are feeling. You will be surprised when you hear when they say, yeah, I don't want you to go to work. I'm fearful that you may get COVID, and that's not good. So just keep that door of communication open and ask your kids how they are feeling. And again, ask yourself how you're feeling. Ask yourself how you are coping with the stress and the uncertainty, because it will transpire how you feel to your kids and their behaviors.
I just wanted to add, in addition to the excellent points Dr. Cornero, Dr. Broderick have made, that there really is power in play, especially for younger children. So finding the space and time to allow your children to play, that's a part of their development, but it also tends to be one of those positive things in a child's life that help them cope in many ways. And there was a point made about going outdoors, maybe taking a walk, finding some opportunities while the weather is still conducive to go outside and play outdoors and get some green space. There's a lot of good studies that indicate that exposure to green space outdoors helps with sort of the psychological trauma and or uncertainty that we are encountering even now and right now with COVID. And then lastly, I just wanted to suggest that being outside, in fact, at least from what we can tell, there may be less risk as it relates to COVID. So certainly I'm not recommending being in a great big crowd of folks, but being able to social distance, maybe with one or two family members outdoors, maybe still keeping your mask on, actually not maybe, keeping your mask on. Those are also some things to consider as you think about ways to help in any way we can normalize or create, again, these positive assets to help your children build out their resiliency.
I definitely appreciate those points, Drs. Cornejo, Gale-Bailey, and Bodrick. I think, as I stated at the opening of this section of mental health concerns are just as important as physical health concerns. I truly believe that we've come a long way in mental health, but still have a long way to go. But certainly during COVID, reducing stigma and shame surrounding mental health concerns, I would just echo that they're very common, and we've been seeing more mental health concerns, anxiety, depression, PTSD, suicidal thoughts, certainly worsening, especially if people had those kind of underlying depression, anxiety prior to COVID. And you can reach out to, if you're a community facing or parent, patient, family facing organization, please ask these questions like Dr. Bodrick mentioned, or Dr. Gale-Bailey, or Dr. Cornejo. How are you doing? Tell me about, what you're doing to cope in COVID. How are your children doing? Because there are resources available, whether that's social networks, potentially individualized therapy, group therapy, and now we have telehealth as well as options. So please reach out and get help if you need it or your child needs it. Wow, we are flying through. The last but very important topic that we want to talk about today is schools. I know this has been a huge challenge for parents in particular. I'll kind of start off with Dr. Gale-Bailey. I know the American Academy of Pediatrics has emphasized in-person return to school as a priority when it is safe to do so. Can you tell me why that's been such an emphasis?
Yeah, so absolutely. I think within the emphasis is when it's safe to do so, but provided that's in place, schools really are a part of the community. They're kind of a community center. But outside of that, specifically what they offer to children are opportunities for growth, development, health, and wellness, and really are offering services that aren't always secured outside of the school setting. So if we consider a child that, again, for some of the examples we've already pointed out, may have encountered abuse, that is something that would have likely been picked up in the school setting. When we think about children who are struggling with behavioral health or their mental health, those are things that we often see because they manifest in the school setting. On top of that, health and wellness is built out in the school setting. That's why school health is so important, and it's part of what's occurring day to day in the partnerships between your school health nurse or your school health personnel and your school leaders. On top of that, students who might have a medical condition or some health complexity really do receive services that increase their ability and or access to education, and also help begin treatments in areas where it's needed. When we think about the allied health professionals that are there in the school setting, physical therapy, occupational therapy, those important services are a part of a child being able to learn at their potential. And so that's what we're all interested here. And we know in the virtual setting, much of that's uncertain. Certainly IEP and 504 is important, whether you're in-person learning or virtual, but the method by which we provide health services or special services, some of those allied health services that I mentioned in the home setting, I think are still being built out. I think we're still trying to figure those things out. I know our school partners are working very diligently to ensure that they're working with families to make sure they have the supports that enable the type of access to education that virtual learning has to provide at this point. But when we think about all that in-person learning provides, we often take for granted how much is taking place right there in the school environment. And that's part of the reason, we could go on and on, certainly, but that's part of the reason I think that all of us as pediatricians recognize, understand, emphasize, and generally speaking, agree with the notion that children are better served and learn better grow and develop more effectively in a school environment where they're able to engage with human beings, with teachers, and with their peers.
And I really appreciate those points. On the counter side, what are the safety considerations? What does safe return to school look like?
That's a great point, and certainly is not a question without a bit of controversy. And much of the way that question is answered depends on a really close-knit relationship with your public health experts who are monitoring the cases of COVID and the increase in cases and mortality and death from COVID. In the setting of community spread of COVID, the rate at which that is occurring, I do think we have to be very cautious about whether we can safely return children to school. There is some information we have available in the evidence so far, at least in children. We know children less than 10 years of age tend not to be as effective in spreading COVID, whereas students or children 10 years and older are going to spread the virus much more and very similarly to the way that adults would. With that said, regardless of whether your school community decides to resume in-person learning, there are certain features that must be in place. So the things that we know are that a face covering, a face mask is incredibly important. That is a very important way to prevent the infectious droplets from being in the environment and creating exposures for other children and other individuals in the school setting. Social distancing in classrooms, incredibly important. Establishing disinfectant protocols for frequently touched areas, incredibly important. Thinking about hallways and how children move through hallways and if they need to move through hallways. But if they did, giving some consideration to making it a one-direction hallway so there are not children kind of encountering each other bi-directionally where they're going to kind of transfer, potentially infectious particles or have the opportunity to come in contact in a way that does not decrease risk of COVID. Lastly, I would just share that, many schools are working really, really hard and thinking really intently about how to go about ensuring children return to school safely and when is the time to do that. The other thing that I've seen many schools look at that is effective and that we have good examples in other nations is around smaller cohorts of students and ensuring that it's the same group of students that a child is with the entire day, that they can take lunch and meals in that same space, and that in the event that somehow a child is positive for COVID, as you think about contact tracing, you've limited it to this smaller group of children instead of having to worry about contact tracing across the whole school building, right? So having these smaller hubs or these cohorts enables a more effective method of determining positives and contact tracing that goes along with that. So we could go on, but there are many things that can happen to provide for safe learning. Using the evidence that's available. My colleague, Dr. Bodrick, talks about science and safety, and that's precisely what we're doing as we think about, when we can bring children back to the school environment.
I think that's so great. And I would, again, plug the DC AAP website, aapdc.org. We have a lot of school health resources on the website that go into detail about some of the topics that Dr. Gill-Bailey was just talking about. We certainly could talk about schools for a whole nother hour, but I'd like to take the remainder of the time to jump into some audience questions. As a reminder, if you are watching and you have a question, please feel free to type it in. The first question that I have is not directed to anyone in particular, but it says, if I am notified by my child's child care center that someone tested positive, should I get my child tested while we are quarantining? And thank you for quarantining, actually. Who wants to take that question? Dr.
Sure,
Barbara?
I can answer that question. So as I mentioned before, I would reach out to your child's pediatrician or primary care provider, and they can best help guide you on whether or not you should get tested. I think there are many pediatricians that would encourage you to get tested, but it really depends on your child's situation, also the capacity to test and our testing supply. So I would reach out to your child's pediatrician, but definitely continue to quarantine.
The only thing I would add to that is that once there is a positive case in a childcare center or school, your public health department is going to engage in what's called contact tracing. So they're going to look at exposures, where they occurred, who was involved, and build out a group or list of individuals that they're going to need to reach out and contact. Outside of that, if you just do have concerns and want to review those concerns, Dr. Bodrick also highlighted some really great opportunities to do so. But generally speaking, if you were at risk, you would be contacted and told that you would need to have some testing done as well as continue your quarantine.
I think I might add too that some of the things that pediatricians are thinking about and public health professionals are thinking about is that science and safety. So questions such as, does your child currently have symptoms, fever in particular, but all of the symptoms Dr. Bodrick mentioned earlier. Was your child wearing a mask when they were exposed to the other child? Was the child who was positive for COVID wearing a mask? What was the duration of time that they were exposed? So did they have a lot of close contact, or was it the contact brief? Were they inside, outside? There are lots of considerations like that in terms of assessing true risk of COVID. I think that's great. Let's move on to the second question. So the question from the audience is, are the medical vans providing medical services in career at the public housing sites? What are the schedules?
That's a great question. So I can only speak on behalf of Children's Nationals at the ARC's medical vans, and we are currently just on site at our practice, 1801 Mississippi Avenue Southeast. I'm not sure about any outreach to any of the public housing sites, but that is an awesome idea. I'm not sure if my colleagues have any idea about that.
So I have not heard about sending the van out to housing sites, but echo Dr. Bodrick's comment that is an excellent idea. The group that I work with in school health and my colleagues have been doing some outreach with the ARC and the Anacostia Clinic around thinking about how can we utilize the van to provide services during this very disrupted sort of health landscape, right? And how do we overcome some of the gaps and barriers that COVID has placed upon us? And, the notion that we could look at actual housing sites and communities is a great option that I would personally love to explore, and certainly we'll take that back to see, how actionable that actually is.
Yes, thanks for the suggestion.
That's great. I think we have time for one more question, and this one was actually directed to Dr. Cornejo. It says, thank you, Dr. Cornejo, for highlighting the importance of supporting national policies that would alleviate food insecurity. Do you have advice for how providers can get involved in supporting such legislation, and what does our role look like?
Thank you for the question. Actually, organizations like the DCAP is a great way of doing this, involving on what they are doing, because usually we get all this information in terms of this policy that is being created. What does the DCAP think about it? I think reaching out to other organizations that can make a change on the community. I'm not sure if you want to add anything to that, Lenore.
No, I mean, I would echo that. I think that, there's certainly a role for advocacy in child health policy and legislation from all community members. And I would say that as a parent, as a member of a community organization, as a leader of a community organization, and DCAP and certainly some of our hospitals as well have governmental advocacy committees that work just on that we try to address some of this policy on a state level. So for DC, that would be DC Council. And also, we're a tri-state area, so sometimes we consider Maryland and Virginia as well, but then also on the federal level as well. And then kind of like one other consideration would be within your personal organization. So for me, it would be within my emergency department division or within my hospital. What could we do to create policies and systemic change surrounding food insecurity? The last question, and I said I wasn't going to ask another audience question, but this is actually answered on the DCAAP website, so I'm not going to open it up to the panelists, but the question is, what metrics should school systems like DCPS use to determine if in-person instruction can resume? That is not a 1-minute answer, but some of the kind of policies and protocols surrounding return to in-person instruction can be found on aapdc.org. Dr. Bodrick, we have only a few minutes. You're our vice president. Would you like to provide any closing remarks?
Sure. So, on behalf of the DC chapter of the American Academy of Pediatrics, it's been a pleasure for us to, spend this past hour speaking with the community about these really important issues regarding children's health. Again, I just recommend that you, if you have any other questions or concerns, that you reach out to your child's pediatrician or your primary care home. And we have additional resources, as we said before, on the DCAAP website at aapdc.org. And we like to just keep this conversation going. So for any of the pediatricians or child healthcare providers out there who may be interested in joining our organization, you can also do that. And I just would like to encourage everyone to continue these conversations.
Thank you. And I would like to thank the Mayor's Office for this opportunity for us to speak today. And a special thanks to Drs. Cornejo, Gill Bailey, and Bodrick for their time. All right, everybody, take care.
Thank you.
Thank you.
Thank you.
Just the name itself, I really like it. Jubilee Jumpstart, like you're jumpstarting your kids to a great future. I really enjoy the name.
Come on, everybody.
It's like a community. It's like a family here. When I brought my kids here, I said this will be a place where I will probably keep my kids here for a long time. I'm a student. I'm a single parent. I'm striving to get my degree, and that is a goal that I'm setting in place for myself, and I'm going to get there. I have 2 kids here. My oldest, Cedric, he's been here since he was 5 months. He's now 4. My youngest, Sydney, she has been here since she was 5 months as well, and she is now 22 months. I mean, I struggle like a lot of other parents, but a lot of my difficulties and struggles that I've had since my kids been here, staff have seen it and they've asked, do you need the help? What can we do to help you? And that right there is something that's big for me.
Enrollment means everybody is starting their Jubilee Jumpstart journey. Children go into their classrooms and we almost immediately are talking to parents about their opportunities for engagement, connection, and growth themselves.
There's different parenting groups you can do. To have a group that you can connect with and be open with and share, it was great. We shared different parenting styles, parenting techniques, and that's what helped me.
Jubilee Jumpstart was founded to address the opportunity and achievement gap. We see in our city and our country that children with less opportunity achieve less, and that is generational. So when we want children to get on a path of lifelong learning, they are supported in that by the people around them also participating in lifelong learning.
When he started here in Jubilee Jump, his mind changing like 100%. They helped me to be a better mother, good person, extra good person. Jubilee helped me to feel more comfort about my person, understanding to my son. They help me a lot.
When you teach at this age, they grasp things like, well, they're sponges. It's just amazing seeing him like grow. Like he loves to teach other people things. He'll show other people things. And it's amazing. And the teachers, I credit the teachers a lot. They are amazing teachers.
Jubilee Jump Start is a special place for me because they gave me so much. Courage, wisdom, it was life-changing.
We learn in community and in relationship. And so our little place is a place where community is built, really family is built, that changes the trajectory. Children can do anything if they are given the right launching pad for it.
We don't just own anybody, we welcome whoever comes in, and we give everybody the opportunity to be here.
Nobody seems to get kicked to the side or the curb. If you see someone that's struggling, hey, you need some help? Let me help you. That's the type of community this is. That's the type of center this is. They're there for me.
To those people who help this center, the only I can say is thank you. God bless those guys who donate those money. Thank you. Thank you, thank you, thank you.
There is a major crisis with America's health system. Millions of people, including many with health insurance, are unable to get the care they need. The solution is simple. Having access to reliable, high-quality healthcare is the way to keep people and communities healthy.
That is why 30 years ago, we created Mary Center, because we believe that everyone should have access to the best possible healthcare, regardless of their ability to pay. For us, quality care is not a service. It's a human right.
For Mary Center, quality care goes beyond just medical care. It includes access to the very best in dental, behavioral health services, low-cost pharmaceuticals, education, and social services. We believe healthy people make healthier communities. So we've decided to refresh our look to show that by connecting each person to the best possible care, we will not only improve lives, but we will strengthen communities too, one person at a time. When Mary Center puts care at the core, you can too. To schedule an appointment or find out how you can help, visit our centers or go online at marycenter.org.
This is a vaccination to keep you healthy. You don't want the measles, do you? Here's your sticker.
Protect your loved ones and they'll pass it on. Don't let COVID-19 stop you from protecting your child.
You're next, Mr. Bear. You need a flu shot.
Now more than ever, it's important your child receives their vaccines on time. Brought to you by the District of Columbia Department of Health.
Ah, good. See, it wasn't that bad.
Do you worry your preschooler doesn't walk, talk, draw, or play like other children their age? The Early Stages Center can help. Our friendly staff will assess your child's development through one-on-one, play-based activities. Early Stages will then connect your family with the educational services that are right for you. Everything is free, whether your child is in public school, private school, or are not yet enrolled in school. Call 202-698-8037, a service of the DC Public Schools.
This is a total no judgment zone. We don't want parents to feel like because of X decision that they've made that they've done something the wrong way, because I know how sometimes difficult it is to manage diet and brushing. So it's important to put families at ease, encourage instead of discouraging, and making sure that they know that we are partners in their care, and not those that are there just to wag a finger or judge them about anything that they're doing. To get a call from a parent that says, I can now breastfeed my child because of you. Maybe they've been told elsewhere they'll never breastfeed their kid, and a simple procedure to do something now changes that whole trajectory for them. Or a child that may have been referred to me and no one can do anything with them. And they come in and I'm going, really? The kid walked in and out smiling, like we had a ball. And we didn't have to do anything like sedation or general anesthesia, which we do pretty often, for them. We didn't even have to do that. A simple, just encouraging, it's gonna be okay, we've got this, we're gonna do it together, let me know what you need. Just kind of thinking about families and thinking about my own family as we make decisions within our practice.
Listen, every day in America, workers are forced to make the unthinkable choice between caring for themselves and loved ones or keeping their job. You know how that can be. Beginning July 1st, 2020, workers in the District of Columbia will be eligible for paid family leave. That's right. When your loved ones need you most, you should be able to step up to the plate and take care of them. That's why DC Paid Family Leave will provide up to 8 weeks of parental leave to bond with a new child, 6 weeks of family leave to care for a sick family member, and 2 weeks of medical leave to care for yourself when facing a serious health condition. Hey, we understand that sometimes life happens, and you shouldn't have to choose between your livelihood and your loved ones. So if you want to learn more about DC Paid Family Leave, check it out at dcpaidfamilyleave.dc.gov.
Complete the 2020 U.S. Census. It is safe and secure. It benefits your city, your community, and your family. When you fill it out, you will help determine where billions of dollars will go, funding our kids' education, school breakfast and lunches, healthcare and Medicaid for our seniors, better social services, creating more affordable housing, job training, and helping everyone have access to food. Complete the census online, over the phone, or once you receive it in the mail. You matter. Get counted. 2020census.gov.
We've been able to really shift our care according to what we feel like the population needs. I think one of the things that makes us strong is that we provide culturally aware care. I think it helps that the majority of our midwives are of color. When we're talking about birth disparities, especially with African American women, I think that we are now entertaining the conversation about years of generational distrust with a lot of healthcare systems. And so I think that we create a safe space for that interaction, not only by having more staff of color, but also just things like our late policy. Midwives, we see our patients regardless if they're late. We see pregnant patients late and we see babies late.
Our whole family is just tied up into Community of Hope.
Hi, I'm Heidi Murkoff, author of What to Expect When You're Expecting, and you may have heard moms matter to me a lot. That's why I founded the What to Expect project and why I'm here to support Mayor Bowser's National Maternal and Infant Health Summit, because every mom should matter. I always say motherhood is the ultimate sisterhood, that no matter where she lives, her cultural, socioeconomic, political profile, the color of her skin, every mom shares a common goal. Every mom wants the best for herself and her baby. But far too many moms, especially Black moms, don't receive the quality, respectful prenatal care they need and deserve. Too many Black moms die of complications of pregnancy and childbirth, and far too many of those deaths are preventable. And the onset of COVID-19 has increased the risks for Black moms. Gaps are widening as clinics and hospitals in rural and urban areas close, and care becomes even less accessible, and more of our most vulnerable moms I speak to every day, are falling through the cracks of care. The truth is we can take care of our moms and control pandemic at the same time. We just have to pick our healthcare priorities, and we have to stop always putting Black moms last, like they don't even matter. One way we can do that by voting. This year, whattoexpect.com, a home to over 19.6 million moms, and the What to Expect Project have launched #MomTheVote to urge moms to speak up and be heard, to vote for those who vote for them, for maternal health care that doesn't discriminate or come with a use-by date, and that isn't paused because of a pandemic, for paid family leave that allows moms to care for themselves and their babies instead of forcing them back to work after only a week or two, affordable childcare, and so many other policies that impact their lives and their children's futures and that of their mom sisters. There's no better investment in our future than the health and well-being of our moms, all of our moms, no exceptions, no disparities. Let's stop failing our moms. Let's make moms the priority they should be.
Sing, talk, and read. Building Early Literacy Skills with Young Children. Hosted by the DC Public Library.
Good morning, everybody. Good morning. My name is Elaine. I am a children's librarian with DC Public Library. I have been working in the field of public library youth services for over 15 years started my career in Philadelphia at the Free Library, and I've been with DC Public Library now for about 9 years. And I am here to talk to you today about one of my very favorite subjects, which is early literacy development. And if you are joining me today, I'd love to hear from you, although I don't think I can see any comments. So that's unfortunate. So I guess we'll just be hearing from me. So I hope you have a great time today. I hope we have some new parents joining us, or people that work with young children, or people that are expecting children. I'm going to give you, I think, just some fun tips on practices that you can use to help your children develop the skills that they need to be successful readers and be ready to begin to read when they start school. So we're going to come up with some kind of fun suggestions and ideas for things you can do, books that you might want to select for your young child, how to read, how to talk, how to play, to encourage all the skills they're going to need. All right, so I'm going to start with some science, and I am not a science person. So, if you are also not a science person, I apologize, but this will be fairly quick and painless. What you're looking at here is an illustration of the human cerebral cortex. And you'll see in these illustrations what this cortex looks like over time in children. So what you're seeing here, what we've got going on are neurons, which are passing information through synapses, and you're looking at these synapses. So these are examples of connections that your child is making. So every time they have a new experience, they're making a new connection. And these synapses over time, you'll see get denser and denser in the brain because they've had so many more experiences. And birth through 3 is when the synapses are developing like crazy. So it's really one of the most crucial times in a person's life are those first 3 years. So we want to make sure that we really understand all that we need to be doing to be getting them ready to be successful in school. So what you're looking at here, what you see with a 2-year-old is they've got about twice as many synapses as they'll end up needing later in life. Okay, they've got all these extra connections. So the synaptic density is really crazy. So when you're talking to a 2-year-old, you've got to understand that they are having to sift through all these connections to make meaning of what you're saying. So sometimes it's going to take them a bit longer to respond when you ask them a question. So you want to make sure that you give them time to sift through those connections first before you move on. And also understand that for a 2-year-old, it can be very, very difficult to focus again, because they've got so much going on in their brain. It takes them so much, they have to go through a lot more steps to make meaning of what's happening. So we need to be patient with 2-year-olds. And what you'll see in the adult brain is that, as we go older, we start pruning away these connections that are not repeated, that our brain doesn't deem as important anymore. So we're better able, we have a more pruned cortex so that we can more easily make meaning of what's happening around us. So, okay, that is enough with the science. Let's move on. Okay, so if you really want to know more about this science, you can click on this link and someone can explain it much better than I can. But what we're going to talk about today, though, is early literacy. And early literacy is simply just everything your child needs to know and learn to be able to begin to read when they get to school, to read and write. So we're going to talk about how we can get them ready. Okay. So this is a kind of an interesting exercise I like to do in this workshop. And again, normally my workshops are much more interactive. I wish I could see and hear you all, but so what I'm gonna do is I'm gonna show you a sentence here. Okay, I am in the way of this sentence. Okay. And so this, unless you speak Yiddish, and not many people on the planet speak Yiddish, unless you speak Yiddish, you probably have no idea what this means. I don't know what this means. I don't know what these symbols are. I'm maybe not even sure if these are words or this is a sentence. This doesn't look familiar with me. I see something that's familiar, which is an exclamation mark, but it's not where I would think it would be based on my understanding of text and print. So I really have no way of making any meaning of this. Okay, so now what we're going to do is phonetically translate that. In the way again. Okay, so now these are characters that I can recognize. Okay, this is an alphabet that I'm familiar with. I know what all of these letters are, and I know the sounds that they're supposed to make. So now I can read this out loud to you. It says, "Gain avec your stinky cats." Now, I see that exclamation mark. Okay. But I have no idea what that means. I can read it, right? Because I understand the alphabet. I understand what sounds these characters form. I understand that these are words. This is a comma here, but I still don't know. I still don't know what it means. I've not heard any of these words before. I have no way of making connection or meaning of these words. So this is something to keep in mind when you're talking to a baby or a young child. Unless they've heard words or seen things repeatedly, they cannot. It's difficult for them to make meaning of it. So now, what I'm going to do is I'm going to read this phrase to you again and see if you can figure out what it means. All right, unless you speak Yiddish and you already know. Okay, so, all right, so I'm going to say, Gehen weg, ihr stinky cats. Gehen weg, ihr stinky cats. Okay, now again, I cannot see your comments, but normally when I do this workshop and I basically act out this phrase, most people get it. Most people say, okay, I think that means get out, you smelly cat, or go away, you stinky cat. And you would be right. Okay, so the translation of this is go away, you stinky cat. Okay. Get that? So it's another illustration of like how important it is to use body language, to use props and visuals, to point to pictures, point to things you see when you're talking to children, so that they can make meaning and connection of the words that they're hearing. Okay, so. So these are literally, okay, the skills that children need over here, and these are the practices that we recommend that best promote these skills in children. So I'm just going to quickly go through this, and we'll see how many of these skills that we might have needed to make meaning of that statement that we saw in Yiddish. So on here I see what letters look like, sound like, and mean. So I really, because I did not know when I saw those Hebrew characters, I did not know what those characters stood for or what they sounded like. And so I was unable to read that sentence. And then how sounds form words. Because I did not know the sounds and I wasn't sure which were the words, I wasn't originally able to make meaning of that statement. How books and texts work, yes, because that sentence for me, I'm used to when I read in English, I read from left to right, but that sentence was written from right to left. So even if I had known what those characters stood for, it still might have been very difficult for me to interpret because it would have appeared backwards to me. The meaning of words, even when I was able to get that phonetic translation, I still didn't know what those words meant. So without having heard those words, knowing those words, I wasn't able to understand the statement. And also information and concepts about how the world works. So that's putting it in context. What would it mean to tell somebody to go away? What would it mean to tell a cat that it's smelly? And two more that we didn't cover. How stories are structured and how to tell a story. So that's a skill that your children will develop a little bit later as they start to grow and develop. And books, language, and stories are fun. We want children become much more successful readers, much more successful in school when they have positive associations with books and language and stories. It's not treated as a punishment or thing they need to do, but something that is enjoyable and enjoyed by others around them. So that's another important thing you can do as a parent, is to have a house full of books at all times. You don't need to buy them. You can always get them from the library. And for your child to see you reading and enjoying reading is a very strong motivator for children. And it will give them positive associations later in life. So we're going to go through these. Now that we sort of understand the skills that we're trying to develop, we're going to go through, again, each of these very simple practices. So we call this workshop the STAR workshop, which stands for Sing, Talk, and Read. But actually, there are two other practices that are very important that are sometimes even overlooked, and they just didn't really fit in the acronym. But those are write and play. Okay, and play is one of my favorites and also one of the ones that's sometimes overlooked. So I can't wait till we get to that one. But we are going to start with, I think, reading. Let's try that again. Okay. Oh, right. Sorry. Okay. So here we have, again, because this can't be interactive, I guess this will just be me answering these questions. But I have, you'll see 1, 2, 3, 4, let's see, seven images here. And each of these images that I picked, I see examples of children developing some of the skills that we talked about. And I usually ask participants to guess or tell me what skills they think these children are developing. In the pictures, there really is no right or wrong answer, but I can tell you what I think I associate with some of these images. So first we see a child over here who is pointing to a stop sign. So he is making a connection between that word stop and the stop sign. And so he's making meaning of that word stop. So he's making an association. So when you're out walking around with your child, it's great. It's really important to narrate your day, to point to things that you see, to tell them what they are, to tell them what they mean. And that is one of the best ways that your children will really develop that vocabulary. This child here, I think, is having lots of fun reading with mom. So she's developing a positive associations with books and reading, as also, you know, as the mom is reading to her and turning the pages of the book and allowing her to handle the book. She's learning how books and text work. Similarly, this baby here who's chewing on this book, a lot of times we dislike when babies are chewing on books, but actually it's a great way for them to develop positive associations with books and to begin to explore the world of print. So this baby is just sort of trying things out, and maybe he's developing a positive association with a book. Maybe he's starting to learn how books work. He learns that the books can open. We have these two little girls here who are actually telling each other a story. So they are practicing that skill of narrating, telling stories, the communication skills. We have this child here who's sharing information and concepts with his friend about how the world works. I'm not sure what he's got there. I don't know if it's a plane or what, but he's explaining that to his friend. So not only does he understand what he's holding, but he can explain it to somebody else. This baby is just having a great time playing with some blocks here. And one of the things actually that you can do to help increase your child's understanding of letters and symbols is to have them practice sorting just about anything. So blocks, colors, anything that they can sort into categories prepares them to be able to identify letters and symbols and better make meaning of those. And this one here, you can see we've got, okay, so they are singing with their baby. I love it. This baby's having a great time. So this baby is exploring sounds and how sounds are broken down and form words. So we are going to now jump into some ideas for how we can develop these skills with our children through these 5 practices. So here we have a baby reading with daddy, I think. And so one of the things you want to do when you're reading is to really make sure, again, that your child has those positive associations. And they're usually better able to focus when they see something that they recognize or that they like. So when you're going through a book with a child, you want to find the things that are most interesting to them and point to them and talk about that. So you want to focus on that. You don't want to force them to read line by line a book that is not interesting to them. You want to find those things that are going to engage them. And they are baby and daddy are pointing out pictures and words as they read together, so they're able to make those connections. And another thing you want to do with children as you read is, again, so they can make those connections, you're going to ask questions, and you want to wait a little bit for them to make a response, even if they're just babbling. Repeating that babble back to that baby will help them develop develop those language skills that they're going to need. And do I have, yes, okay. All right, so we're going to talk about a couple techniques for reading aloud with children. As far as selecting books for children, we have some really great selection recommendations on the DC Public Library website with our star pages. And not only do we have recommended books, let's see if I can click on that real quick. Broken down by ages, but tells you a lot about how to select those books and what you're going to be looking for here. So with our very youngest infants, they're very, very young. They can only see in black and white. So black and white books are really great for them. And as they get a little bit older, you still want to kind of try and stay with like strong, bold primary colors that they're really able to engage with. And also you've got touch and feel books. So those sensory associations are really important for babies. And babies really like things that are familiar to them. So I'll show you a couple examples later of books that I think work really well for that age group. We're gonna go back here. Okay, and I'm gonna, these are gonna sound like kind of fancy words, but it's really pretty simple. So two types of ways of reading aloud to children that maybe aren't as commonly used, rather than just, again, reading word for word, are picture walk. And that means that you are really, you're not necessarily reading the text line by line. What you're doing is you're going through the book, you're looking at pictures, you're pointing out what you see, and you're talking about what you see. You can talk about that with your child. So you don't have to read a book from front to cover, word for word. And dialogic reading, which is, this is really important, and particularly as children get older and starting to make more meaning of the world, is to stop and ask questions when you're reading, and to allow children to make predictions about what might come next in the story, and make personal connections, because again, that will really help them develop their understanding of language and context. So this is a very simple, very sweet book that I recommend for babies, which I have checked out through the library, electronic versions. So I'm just gonna quickly kind of take you through it and give you some examples of what I'm talking about. So let's see. Okay, oh, I was further on in this book than I meant to be. Okay, so this is called Peekaboo Morning. It's by Rachel Isadora. And it's a really sweet book. And so we see this little baby here, and we could read this line per line. We say, Peekaboo, I see my grandma and grandpa. Peekaboo, I see the moon. Peekaboo, I see my daddy. Okay, so this is a really sweet book and I love it. And there aren't really a lot of words in this. It's almost sort of written as a picture walk. But again, to give you an example, you don't necessarily need to read word by word. You could even talk a lot about other things that are going on in the pictures. So you could stop here. Maybe your baby is interested in trees. We can talk about this tree. What color is the tree? The tree, we see that the tree is brown. And I see the grass down here, which is green. I see the sky, which is blue. And look at all those stars. Can we count all those stars? That's a lot of stars to count. So I'll go to one more page here. Oop. Yeah. Okay, and so the only text on here is, I see my daddy and peekaboo I see, but what else do we see? What else do we see here? So we see a stroller. And we see that stroller has wheels on it. Let's see how many wheels are on that stroller. So you could count the wheels on the stroller. You could talk about what colors and shapes you see. You could see, what's here? Daddy's got a ring on his finger. All right, and then baby's peeking out there from behind the wall. So you don't have to stop at what's the text that's in the book. You can really, really increase your vocabulary and understanding by really stopping and really absorbing illustrations in a book and talking to them about the context of those illustrations in a way that is fun for them. So, okay. An example of, let's move on to the next page. So an example of dialogical reading would be sort of asking them maybe even some open-ended questions when they get a little bit older. So we peekaboo, I see my cat. Oh, cute. If you had a cat, would you hug it like that? What would you do if you had a cat? Or what kind of pet would you like if you could pick a pet? Or making a prediction. Okay, so we see this baby is looking up at this table that's got a bunch of food on the table. What do you think that baby's gonna do? What would that baby do next? Let's find out. Okay, so I'm gonna move on from that, but those are just examples. Again, oh, did the baby do what we thought? Yep, okay, the baby ate the cookies. Yeah, oh boy, can't see that. Okay, so we're gonna move on here. I really don't want that on my screen. Okay. Okay, so now we're going to talk about talking, which I really believe is the most important practice that we need to be doing. And sometimes parents don't think that they need to talk much to young children because before they've developed those language skills, maybe they can't talk back, or they think, they don't understand what I'm saying. But again, the only way you're ever going to understand the meaning of words and context of words is by hearing them over and over again. So from the time your baby is born, you want to be talking to that baby as much as you possibly can. And that can be a little bit awkward sometimes, but we can give you some ideas for how to do that and not feel so weird. So one of the things we suggest is that as your baby is babbling and making sounds, like you may not know what that baby means by that, but just repeating those sounds back to them. And that's sort of the beginnings of communicating and the baby's understanding that sounds have meaning. Another thing you can do if you're not sure really what to talk about with your baby is to narrate your day. And this is a really great thing to do. So when you put the baby in a stroller, you say, okay, we're going in the stroller. Okay, all right, now the wheels are rolling on the stroller. I'm gonna wheel you all the way to the car. We're getting in the car. Once we get in the car, we're going to drive to the grocery store. And as you're driving, you can point out stoplights, you can point out trees, you can point out buses. So, if you're at a loss, you can always talk to your baby about what you're doing and what's going on with them, and that will help them make meaning of those words. And when you're playing with your child, or you see your child playing, you can add more details rather than just saying you're playing with a ball. You can describe the ball. Okay, that's a blue ball. Okay, you're rolling the ball. The more words they hear, the greater their vocabulary will be. And when they learn to decode print and text, they'll know what those words mean. Just simply knowing what sounds make and being able to read something aloud doesn't mean that you know what the words mean. You have to hear them in context. Okay. Okay, singing. And this is not something, not everybody is comfortable with singing, so that can be a difficult sell. Sometimes for some parents, they don't feel like they sing well. Maybe they don't like singing. But singing is a really great way. I think all of us can probably think back to preschool or childhood and think about how many songs that we learned and how it helped us learn meaning. There are songs maybe that we still remember. We like to choose songs for young children that have a really strong rhythm and repetition. So you're hearing those words kind of over and over, and that reinforces learning. So for instance, a song a lot of us are familiar with is Wheels on the Bus. So the wheels on the bus go round and round. The wipers on the bus go swish, swish, swish. But you got that strong refrain. Wheels on the bus go round and round, round and round, round and round. The wheels on the bus go round and round, all through the town. So that's a fun one. Kids really like. There's a lot of things they can identify with in that, and it does have that strong rhythm and repetition. So they start to learn what wheels are, what a bus is, what it means to go shh. And it's fun for them. Children, most of you who have been around young children understand that they really enjoy singing. They enjoy being sung to, and it's a great way also of making connections. And also when we sing, it slows down language a little bit. I know if anybody who is familiar with learning a language, sometimes when we're learning language, we can start to decode what people are saying, but it takes our brain longer to do the translation. So when people are talking very quickly, it can be really difficult to understand. Sometimes we have to ask people to please slow down so we can do those translations in our brain and understand what they're saying. So singing is a way of sort of naturally slowing down language, and using pictures or props. Again, we talked about a great way to help your child make those engagements and associations. Like, for instance, when I use this cat here. Okay, writing. And again, sometimes people think that your child doesn't really need to experiment with writing, or writing is a skill that they're going to develop later after they learn to read. But it's never too soon to start your child with developing those writing skills as well. So the beginning of developing writing skills is literally just once they can hold a crayon or something in their hands, allowing them to scribble. The more they can scribble and experiment with the idea that they can put symbols to paper, this is going to prepare them to learn to write later on. And as we talked about before, even playing with blocks and shapes and certainly letters can help children begin to that sorting skills help them begin to break down symbols so that they can understand written text better. One of the things I really love to do is not just read books to children, but to tell stories with children, to encourage them to tell stories. And what you can do too, which is a lot of fun, is to, once you make up stories and you can write them down together. Your child, that's something a lot of children can really enjoy. When they see their stories written down on the page and they can read them back to them, they feel a sense of personal pride and engagement. I like to even sometimes take just a story, or we can take a book like, say, Goldilocks and the Three Bears, and just simply substitute your child's name so that your child is the hero of the story. So that's just another little suggestion from me. Okay. Playing, again, as I mentioned before, playing is often kind of overlooked. People maybe don't understand the importance of play, or maybe they just think playing is something for their child to do with another child. But playing with your child is really important, because you are the one that really has background knowledge and vocabulary to really describe what they're doing and what they're seeing. So as they're playing, you can point to things that they're holding. You can ask them questions about it. Let's see, your child what is this child playing with here? Okay. Oh, I think he's playing with maybe a hammer. Okay. So yeah, so that child is interested in playing with hammer. And we can talk about, a hammer is a tool. What can we do with the hammer? Let's experiment with the hammer. Can we hammer on the table? Can we hammer on the chair? You get the idea. But playing is fun for children, and I think all of us can relate to, as learners, when we're learning something new, we're much more likely to learn when it's something that is fun for us and interesting and engaging. So starting with what your child is interested in, starting with playing with your child, is a really great way to help get them ready to read and write later in life. Okay, hold on a second. Okay, whoops. me 1 second here. Sorry about that. It's not a technical problem here. Okay, no. Okay, sorry about that. Okay, so I sort of whizzed through this because I'm not able to see comments, so I was really building a lot more time for questions and interactions, but I'm gonna show you a few more things that you may wanna check out. One here are book recommendations by, let's see, oh, there's the chat. Oh, let's see, okay. All right, I apologize now, I am just seeing the chat. Sorry, this is my first time doing this virtually. I apologize. A strong, Kirsten asked if there was a strong recommended song to encourage hand washing. And actually I have heard a few of those. Some of my colleagues have found. I don't recall the names of them, but one thing you can do too, just if you want to make sure your child is really doing that 20 seconds of hand washing, you can sing. The time that it takes to sing that ABC song is about 20 seconds long. So you can have your child sing the ABC song while they're washing their hands, and when they get to the end, they know that they've washed them for the appropriate amount of time. Okay, again, I apologize that I had not seen the chat prior to this. Okay, so these are some great recommendations. We might have clicked on this before, but this is the STAR page through DC Public Library. I really love it. Explains a lot of what I'm explaining now. One of the programs I have not yet mentioned is Books from Birth. I hope most of you know about this really great program. We have a grant that allows us to purchase a book a month for every single family in DC with a child under 5. It's very easy to sign up, and we send you an age-appropriate book every month in the mail, and that is still going on. So if you have children in that age group and you've not yet signed up for Books from Birth, please do that. You can do that today. It's very, very easy to sign up. So these are, again, some early literacy tips. Here's expecting a baby, birth to 1, 1 to 3. So I think we've looked at birth to 1 before, so we'll look at 1 to 3. Okay. Okay, so okay. So this is when your toddler is starting to develop early language skills. So they are going to start to sort of recognize words and make meanings of words. They have more developed motor skills than your infant. They're going to be moving around. We're going to be encouraging your toddler to do things on your own. And like, as we talked about, sorting things by size and color. And these normally appear in image form, but so these are examples here, Peekaboo What, Dear Zoo, examples for books that you might want to choose for your toddler. Rhyming books are really great. Again, books with really strong rhythm and bright colors. That's okay. Let me go back here. So there's some great recommendations on that page. I encourage you to take some time with that. Put this away. I just picked out a few of my some fun board books the other day from the library, and so these are examples of great books to read with the very youngest children. And so I love this one. It's called Who, and it's a celebration of babies, and it has different families on each page, and it tells you here's Dada, and here's Baby and Dada. Okay, so that's something most babies will start to recognize their fathers, their mothers, their dog. Here's our doggy here. And then here's a bird, and here's baby and bird. And it also has that repetition and shows all kinds of different families. It has nice bright colors. It's in board book form, so your baby kind of can't destroy it. They can chew on it, whatever. So this is a great book for our youngest children. This one I like is called Baby's First Words. And it's really fun. So again, if you can't get out of the house and out and about and talk about what you're seeing, you can always, you can read books like this, where children can see lots of different things going on. And it even prompts you to talk about, we see a butterfly, here we see a ball, here we see a swing, here's daddy's scarf, here's daddy's glasses. Here we have children, really young children. One of the things they first start to identify outside of other babies in their family are different animals. So there's a lot of fun animals on this page that you can talk about in nice bright colors. Okay, all right. This. Okay, and one last one here. We've got a nice touch and feel book. Okay, so this is great. This is a really fun sensory one. All right, we've got a kitty cat here, and we're scratching this page. This one was kind of hard to see. All right, so this is nice and soft. Your baby can feel that, and you can talk about how soft the kitty's tummy is. And this is something shiny we can scratch. So this is a lot of fun for babies to explore, and lots of opportunities to talk about different senses, colors, etc. Ooh, I like this cardboard here. Okay. And another thing I want to share with you all, before we go, is our calendar, so DC Public Library. So we have programs every day of the week. Sometimes multiple programs per day. There are a lot of virtual programs going on at DC Library. You can also, again, that Peekaboo Morning, which I read, I downloaded as an ebook. You just need the Libby app to do that, and it's very quick. If you have questions about that, you can always go to dclibrary.org and ask to chat with the librarian, and they can walk you through it. But we have a great selection of ebooks for kids right now. We also have a limited number of libraries open. So if you would like a physical book or print book, you can go online and request to have those books sent to your closest open location, and you can go in and pick those up and bring them home. Okay, so this is a link to our schedule. Let's see, another chat. Okay, let's see. Okay. Kirsten, what can parents do if their kids aren't meeting developmental milestones related to reading and writing? Yeah, so as the skills and practices that I'm going over are the most commonly used, and those generally do work if they're being used on a regular basis. But sometimes kids do have challenges that can't necessarily be addressed with those traditional practices, or that they need more reinforcement. So there are one of the early stages. Okay, so in Washington, D.C., an organization I really like to recommend is called Early Stages. Let me see if I can find a link for that real quick. And so what they will do is they will do developmental testing. If you contact them, they can assess your child for learning disabilities, and then they have a specialist that often will do home visits and work with your child. But I would say, yes, either if your child is not yet in school and you have questions about that, I would either contact a doctor, but Early Stages is a really great resource. I'll see if I can find that link. Let's see. Yes, Strong Start. So Early Stages and Strong Start, I believe, are well, let's bring up Strong Start. Okay. Okay, so I'm going to put a link to Strong Start in the chat. Ooh. Okay. And yes, most children's librarians at DC Public Library have a Strong Start contact. So if you are at the library and you have concerns, you can talk to a librarian about it. But right here in this link, you'll see there's a hotline for a referral process. Sometimes Strong Start representatives do even visit libraries or attend story times to talk to parents about the work that they do. But they're really valuable, and it's a free service. So I really encourage you, if you have questions about that, to contact them. Okay. Okay. Here is our calendar. So this is DC Library programming calendar. As you can see, there's a lot going on, but we have virtual story times every weekday, Monday through Friday at 10:30 a.m. They last for about 30 minutes. They're a lot of fun. So if you are needing more ideas for books and songs and activities you can do with your children to encourage early literacy development, these are a lot of fun to watch and check out, and you can get some great ideas. It looks like we're having a STEM story time. So there's new programs popping up all the time. There'll be more and more coming down the pike in October, so do keep an eye on our calendar. You can also follow DC Library at DC, let's see, on our Facebook page. I forget the actual link for that, but I think it's dclibrary.org/Facebook. Okay. Okay, so I think I've covered, again, let's see, what age should the free monthly books from DC Public Library end? I feel like these are from Teresa. Yeah, the Books from Birth program, that your child qualifies for a free book every month from birth up through the age of 5. At the age of 5, they age out of the Books from Birth program. How can we introduce to our kids another language, for example, Spanish? So yeah, so if you're wanting your child, which is great, obviously the more languages your child is learning and being exposed to at a young age, the better their language skills will become even overall. And it's also easier for them to learn new languages when they're introduced to them very early on. So if for example, you would want to introduce your child to Spanish, and you would do that in much the same way that I'm talking about in general early literacy development. So one thing, singing songs, learning songs and singing songs to your child in Spanish. DC Library has a very large collection of bilingual books, so that if you are not comfortable with the language you're introducing your child to, you can see the text written in both English and Spanish. Obviously, introducing them to or having them be around people that are native Spanish speakers, the more they are hearing that language in conversation and context, the more they will be able to make meaning of those words. Okay. Is it recommended for kids to learn? Is it recommended for kids to learn through tablets or phones, and for how long should we be exposed to these devices? So we're learning more and more about that. We're learning more and more about sort of screen time for young children, I think, every year as time goes on. So what I will tell you is that if your child gets, your child that's under 2 is not going to, there's not a lot of learning occurring in the brain when they're in front of a screen or in front of a tablet. So they might be sort of mesmerized by, the glow or something they're seeing, but they're not making any connections. One thing we have found is, though, if you are sitting with your child and sitting with a tablet and you are helping them, you are talking with them, asking questions, that they may be able to make those connections, but they really need you to be present in making those connections for them, because they won't learn just from the video. That said, I think a lot of parents are overly concerned about, what would happen if their young child is exposed to screen time. It's not it won't hurt them, It won't hurt them if you want to stick them in front of a tablet for a little bit just to give yourself a break, but just understand that they're not going to actually be learning from those devices until they're 2 or over. They're going to be making those connections primarily through you or another person. And again, tools to help parents to identify if a child has learning delays. I did post a link to the Strong Start program, which is the early intervention program. So that I would say they are really the experts. They are really the experts on that. So I would get in touch with Strong Start or take a look at their website to see what they recommend to identify whether a child might have a learning delay or not. And again, they will do an assessment for free too if there are concerns about that. Okay. All right, well, let's see. I don't know if there's any other questions here. Again, thank you for anyone watching. Thank you for bearing with me through this. This was my very first time doing this workshop in a virtual format. And there's kind of a lot going on here. So hopefully next time we present this in a virtual format, we'll have this down a little bit more smoothly, but this is still fun. It's always fun for me to cover this content. It's always fun for me to connect with parents and caregivers. Thank you so much. Let's see, I'll wait a second or two to see if there are any other questions. But we may wrap up in just a minute. And again, I apologize for some distractions with my computer. Let's see. Okay. Any other programs if your child is too old for a Strong Start? Oh, that's a good question too. And I do get that sometimes. Again, because they are really the experts in that, I would contact Strong Start and ask what those programs are. Because even if they can't provide that service, they should be able to refer you to sort of the best service for a child of that age. Also, again, if your child is in school, I always recommend, talking to teachers or counselors at the school because they should theoretically be able to help with that type of assessment and or give you referrals to an appropriate service that would be able to make that kind of assessment. But I do encourage parents, if you have any concerns about that, don't hesitate to reach out and get those referrals because learning delays definitely can be addressed in most cases, but it's best when we catch them early on. So if you have concerns about that, I would say yes, go ahead and contact Strong Start. Or contact your child's school and ask which are the best services to identify if your child might have a delay. Okay. Any other questions here? This was fun. This was weird. But again, thank you so much for joining me today. If you have any other follow-up questions, either for me or for DC Library, etc., I'll put my contact info in the chat. But and I can also try and refer you to an appropriate person to answer your question if it's not something that I am equipped to answer. What is it? Not even my email address. Okay. All right. Yeah. So this is my email address right here. So feel free to contact me if you have further questions. Thank you for joining us for the summit today, and have a great rest of your day, everybody.
There's a major crisis with America's health system. Millions of people, including many with health insurance, are unable to get the care they need. The solution is simple. Having access to reliable, high-quality healthcare is the way to keep people and communities healthy.
That is why 30 years ago, we created Mary Center, because we believe that everyone should have access to the best possible healthcare, regardless of their ability to pay. For us, quality care is not a service, it's a human right.
For Mary Center, quality care goes beyond just medical care. It includes access to the very best in dental, behavioral health services, low-cost pharmaceuticals, education, and social services. We believe healthy people make healthier communities. So we've decided to refresh our look to show that by connecting each person to the best possible care, we will not only improve lives, but we will strengthen communities too, one person at a time. When Mary Center puts care at the core, you can too. To schedule an appointment or find out how you can help, visit our centers or go online at marycenter.org.
This is a vaccination to keep you healthy. You don't want the measles, do you? Here's your sticker.
Protect your loved ones and they'll pass it on. Don't let COVID-19 stop you from protecting your child.
You're next, Mr. Bear. You need a flu shot.
Now more than ever, it's important your child receives their vaccines on time. Brought to you by the District of Columbia, Department of Health.
All good. See, it wasn't that bad.
Do you worry your preschooler doesn't walk, talk, draw, or play like other children their age? The Early Stages Center can help. Our friendly staff will assess your child's development through one-on-one, play-based activities. Early Stages will then connect your family with the educational services that are right for you. Everything is free, whether your child is in public school, private school, or not yet enrolled in school. Call 202-698-8037, a service of the DC Public Schools.
This is a total no judgment zone. We don't want parents to feel like because of X decision that they've made that they've done something the wrong way, because I know how sometimes difficult it is to manage diet and brushing. So it's important to put families at ease, encourage instead of discouraging, and making sure that they know that we are partners in their care and not those that are there just to wag a finger or judge them about anything that they're doing. To get a call from a parent that says, I can now breastfeed my child because of you. Maybe they've been told elsewhere they'll never breastfeed their kid, and a simple procedure to do something now changes that whole trajectory for them. Or a child that may have been referred to me and no one can do anything with them, and they come in and I'm going, really? The kid walked in and out smiling, like we had a ball. And we didn't have to do anything like sedation or general anesthesia, which we do pretty often, for them. We didn't even have to do that. A simple, just encouraging, it's gonna be okay, we got this, we're gonna do it together, let me know what you need. Just kind of thinking about families and thinking about my own family as we make decisions within our practice.
Listen, every day in America, workers are forced to make the unthinkable choice between caring for themselves and loved ones or keeping their job. You know how that can be. Beginning July 1st, 2020, workers in the District of Columbia will be eligible for paid family leave. That's right. When your loved ones need you most, you should be able to step up to the plate and take care of them. That's why DC Paid Family Leave will provide up to 8 weeks of parental leave to bond with a new child, 6 weeks of family leave to care for a sick family member, and 2 weeks of medical leave to care for yourself when facing a serious health condition. Hey, we understand that sometimes life happens, and you shouldn't have to choose between your livelihood and your loved ones. So if you want to learn more about DC Paid Family Leave, check it out at dcpaidfamilyleave.dc.gov.
Complete the 2020 U.S. Census. It is safe and secure. It benefits your city, your community, and your family. When you fill it out, you will help determine where billions of dollars will go, funding our kids' education, school breakfast, and lunches, healthcare and Medicaid for our seniors, better social services, creating more affordable housing, job training, and helping everyone have access to food. Complete the census online, over the phone, or once you receive it in the mail. You matter. Get counted. 2020census.gov.
We've been able to really shift our care according to what we feel like the population needs. I think one of the things that makes us strong is that we provide culturally aware care. I think it helps that the majority of our midwives are of color. When we're talking about birth disparities, especially with African American women, I think that we are now entertaining the conversation about years of generational distrust with a lot of healthcare systems. And so I think that we create a safe space for that interaction, not only by having more staff of color, but also just things like our late policy. Midwives, we see our patients regardless if they're late. We see pregnant patients late and we see babies late.
Our whole family is just tied up into Community of Hope.
Hi, I'm Heidi Murkoff, author of What to Expect When You're Expecting, and you may have heard moms matter to me a lot. That's why I founded the What to Expect project and why I'm here to support Mayor Bowser's National Maternal and Infant Health Summit, because every mom should matter. I always say motherhood is the ultimate sisterhood, that no matter where she lives, her cultural, socioeconomic, political profile, the color of her skin, every mom shares a common goal. Every mom wants the best for herself and her baby. But far too many moms, especially Black moms, don't receive the quality, respectful prenatal care they need and deserve. Too many Black moms die of complications of pregnancy and childbirth, and far too many of those deaths are preventable. And the onset of COVID-19 has increased the risk for Black moms. Gaps are widening as clinics and hospitals in rural and urban areas close, and care becomes even less accessible. And more of our most vulnerable moms I speak to every day, are falling through the cracks of care. The truth is we can take care of our moms and control pandemic at the same time. We just have to pick our healthcare priorities, and we have to stop always putting Black moms last, like they don't even matter. One way we can do that by voting. This year, WhatToExpect.com, a home to over 19.6 million moms, and the What to Expect Project have launched #MomTheVote to urge moms to speak up and be heard, to vote for those who vote for them, for maternal health care that doesn't discriminate, or come with a use-by date, and that isn't paused because of a pandemic. For paid family leave that allows moms to care for themselves and their babies instead of forcing them back to work after only a week or two. Affordable childcare and so many other policies that impact their lives and their children's futures and that of their mom sisters. There's no better investment in our future than the health and well-being of our moms, all of our moms, no exceptions, no disparities. Let's stop failing our moms. Let's make moms the priority they should be.
I'm Polly Donaldson, Director of DC's Department of Housing and Community Development, and I wanted to talk about affordable housing in the District of Columbia and our affordability crisis. The rule of thumb is you should only spend about a third of your income on your housing needs. We know we have to do more in the District of Columbia.
Mayor Bowser has been a national leader in affordable housing policies and funding, but she realizes we need to do more. So she challenged the city to produce 36,000 housing units by 2025, with 12,000 affordable to low-income residents. Our first analysis is looking at where affordable housing is across the city and where it should be in the future. This summer, we asked residents to examine a map of affordable housing in the city.
I feel the distribution of affordable housing in the city could be a lot better. It seems too much of it is concentrated east of the river in Ward 7 and 8, and not enough of it in Ward 3. Ward 3 would be a perfect place to have more affordable housing. It's resource rich.
For me, housing and affordable housing is personal. I first got involved in producing affordable housing for our homeless families over 30 years ago. To me, it's all about who is your neighbor, and are we able to say that anybody who wants to be in the district, whether you've been here for 5 generations or for 5 minutes, there is a place for you in the District of Columbia.
Clara is our first child, and we didn't know what to expect being first-time parents. And it's just been such a fun experience to watch her grow. Starting out very early, we monitored Clara's development using the Learn the Signs Act Early checklist. It was just an amazing resource to be able to say, okay, this is what she should be doing at this age, and it calmed our fears a little bit.
I would have to say my favorite resource of the Learn the Signs Act Early would be the app. But having the app readily available has honestly been great. And it's been awesome just seeing her development and growth. The Learn the Signs Act Early app is actually very easy to use. I can access it right there on my phone. And whenever my mind kind of pops to it, I can open it up.
I think I am a Learn the Signs Act Early super user. The Learn the Signs Act Early materials have been invaluable to me because I feel like they've been there with me throughout parenthood in kind of the way that a wise old friend might be.
Using Learn the Signs Act Early has helped me monitor my daughter's development and gives me a great peace of mind that the information is accurate and it's backed by science. It's fun to see when she achieves a milestone. I feel very proud for her and excited.
And it's not just a milestone of, is my child doing this next thing? It's what should I be working with my child next? Because that can be a big question mark as a first-time parent.
I want to know if maybe she's lagging farther behind than she really should, and that's something to bring up with our pediatrician.
Having something at my fingertips to kind of go through it with her physician. She's hitting these milestones, but not these other milestones. Should I be concerned? What kinds of things can I do to bring her up to speed? And then taking that and translating it with her teachers in her classroom to make sure these are the things I would like to focus on, and how can we work together to make sure that she's developing appropriately.
The Learn the Signs Act Early resources empower parents to take a stake in tracking their child's developmental milestones.
Just the name itself, I really like it. Jubilee Jumpstart, like you're jumpstarting your kids to a great future. I really enjoyed the name.
Come on, everybody.
It's like a community. It's like a family here. When I brought my kids here, I said this will be a place where I will probably keep my kids here for a long time. I'm a student. I'm a single parent. I'm striving to get my degree, and that is a goal that I'm setting in place for myself, and I'm going to get there. I have 2 kids here. My oldest, Cedric, he's been here since he was 5 months. He's now 4. My youngest, Sydney, she has been here since she was 5 months as well, and she is now 22 months. I mean, I struggle like a lot of other parents, but a lot of my difficulties and struggles that I've had since my kids been here, staff have seen it and they've asked, do you need the help? What can we do to help you? And that right there is something that's big for me.
Enrollment means everybody is starting their Jubilee Jumpstart journey. Children go into their classrooms and we almost immediately are talking to parents about their opportunities for engagement, connection, and growth themselves.
There's different parenting groups you can do. To have a group that you can connect with and be open with and share, it was great. We shared different parenting styles, parenting techniques, and that's what helped me.
Jubilee Jumpstart was founded to address the opportunity and achievement gap. We see in our city and our country that children with less opportunity achieve less, and that is generational. So when we want children to get on a path of lifelong learning, they are supported in that by the people around them also participating in lifelong learning.
When he started here in Jubilee Jump, his mind changing like 100%. They helped me to be a better mother, good person, extra good person. Jubilee helped me to feel more comfort about my person, understanding to my son. They helped me a lot.
When you teach at this age, they grasp things like they're sponges. It's just amazing seeing him like grow. Like he loves to teach other people things. He'll show other people things. And it's amazing. And the teachers, I credit the teachers a lot. They are amazing teachers.
Jubilee Jumpstart is a special place for me because they gave me so much. Courage, wisdom. It was life-changing.
We learn in community and in relationship. And so our little place is a place where community is built, really family is built, that changes the trajectory. Children can do anything if they are given the right launching pad for it.
We don't just own anybody, we welcome whoever comes in and we give everybody the opportunity to be here.
Nobody seems to get kicked to the side or the curb. If you see someone that's struggling, hey, you need some help? Let me help you. That's the type of community this is. That's the type of center this is. They're there for me.
To those people who help this center, the only I can say is thank you. God bless those guys who donate those money. Thank you. Thank you, thank you, thank you.
Good afternoon, and welcome to the Promoting Opportunities for Young Parents to Thrive panel. My name is Samara Stone, and I'm the Director of Youth Policy and Programs with DC Action for Children. I'd like to start by thanking Mayor Bowser, Dr. Faith Gibson Hubbard, and the Thrive by 5 team, my colleague Rakaya Anbar Shaheen for serving on the Planning Committee, and all the organizers of this summit for providing a much needed space to discuss maternal and infant health and prioritizing youth voice. I have the pleasure of co-designing this panel with 4 fabulous young people that you'll be hearing from shortly. But before then, I want to take a moment to talk about why we must elevate the stories of young parents. The challenges that they face are very unique and primarily rooted in policies, programs, and systems that make it difficult for them to thrive. In a recent report by the United Parent Leaders Action Network, they surveyed over 100 young parents between the ages of 18 through 24 years old. And they reported feeling alone and lacking support, struggling to find and keep affordable housing, quality healthcare and childcare, and balancing parenting, educational goals, and jobs that pay family-sustaining wages. Not to mention the hassle of applying and often reapplying for assistance programs such as childcare vouchers and other subsidies. Similar to the parents surveyed, our panelists today also share similar stories. I asked them to describe one word that summarizes how they felt when navigating multiple programs, policies, and systems while pregnant or with a child. I will introduce them and end with the word that they each selected to describe how they felt. I will start with Naasia Hawkins. She is 19 years old and a senior in high school. She has a 2.5-year-old son named Joshua. After graduation, she hopes to attend college and enter the medical field. She's a former member of the YWCA's Young Women's Advisory Council, and her word that she chose was hectic. Tanasia Matthews is 24 years old and has an 8-year-old son named Jalil. She is currently a graduate student working on her Master's of Social Work degree so she can advocate for teen parents. She was also a member of the Young Women's Advisory Council, and her word is frustrating. Dejanay Hines is 22 years old and has a 2-year-old son named D'Angelo. She works as an intern at Casa for Children of DC. She also owns a small business that specializes in baking and catering. Her word is optimistic. Jenny Redmond is 24 years old and has a 1-year-old son named Tayden. She is engaged in programming through Sasha Bruce Youth Work. She loves making candles and plans on launching her own business selling candles soon. Her word that she chose is overwhelming. So with that, I am going to have the panelists think back to the beginning and think back to before things were overwhelming, hectic, and frustrating. And I want them to think about when they first learned that they were pregnant. What was it like for them? What challenges did you guys face when it comes to navigating systems? And what was that like? So I am going to start with Tanasia.
Yeah. So when I first found out I was pregnant, I was 15. And that was a really scary time for me and my family because we didn't know what we would do, how, we would move forward. But my support system was really strong. My mom, my grandma, my son's dad, his mom, his family, everyone was really supportive. And so when I found out I was pregnant, I was actually already 6 months pregnant. So there was really no time for me to prepare or anything like that. I had 3 months to go before this baby was coming. And so I think one of the challenging things was navigating, prenatal care. And it was not no prenatal care in my neighborhood. So I had to travel to Washington Hospital Center. And I live in Ward 8. And so sometimes me and my son's dad, we were missing school because I had doctor's appointments or, I was considered a high-risk pregnancy. So I had to be monitored or something like that. So it was really difficult in the beginning, but we've managed to get through it.
Thank you so much for sharing, Tanasia. What about you, Dejanay? What was that like for you?
For me, when I first found out that I was pregnant, it was really scary for me because I didn't know how my son's father would react and everything. And then on top of that, I wasn't really in a position to be having a child, but one of my obstacles that I dealt with the most when I was pregnant was trying to obtain housing. And another thing was the prenatal care as well. And getting WIC and all of that was also another thing that I had to deal with as far as the pregnancy and everything goes.
Thanks. And what about you, Jenny? What was it like for you when you first learned that you were pregnant?
When I first found out when I was pregnant, it was scary. I found out at 4 months, so I was like nearly halfway through the process. My support system wasn't that strong. I had my sisters and a couple of my cousins. I'm a single mother, so I didn't really have his father to be around to help. A challenge for me was, I would say, prenatal care too, because my health insurance at the time, it wasn't really up. So that and trying to get housing.
Mm-hmm.
But that was all during my pregnancy.
Thank you. So it sounds like there were a lot of challenges from just not having a hospital in Ward 8. It sounds like you guys had challenges with healthcare benefits, navigating those systems early on. So what about you, Na'Asia? What challenges did you have?
My challenges as well was traveling back and forth for prenatal care when I was living in Ward 8 also. I had to travel all the way to Washington Hospital Center. But then it's like my insurance switched over. Then I was in between Howard and Washington Hospital. So that was the only challenge for me with prenatal care, because it's like whenever my insurance changed, I had to hop from another hospital and do things all over again. So that was my challenge.
Okay. Thank you all so much for sharing. So I know one of the things that is also can be challenging to navigate as a parent and as in being pregnant is education. And so I know that Na'Asia, with you, you're currently a senior in high school. I know with you, Tanasia, you're a graduate student. And so can you talk a little bit, Tanasia, about what it was like for you navigating your undergraduate years?
Sure. So, excuse me. I graduated high school in 2014 on time. And I went right into my undergraduate degree. So at the time, my son was 2. And it was a little challenging for the simple fact daycare was always something that was up in the air, I would say. I had family members that was willing to watch him, but I wanted my son to be like in daycare, to be around his peers. I felt like if I was in school, he should go to school and kind of like start that learning process. And so I realized that colleges are not really welcoming to student parents. Like there's nothing there, in your college that says we welcome you or we want you here. Like, yay, you this is a complete, huge milestone for you. My college had probably one parent support group a week. And those times were conflicting with the times that I had classes. So if I missed it, then it was like, okay, you wait till next week. And then it was just like, when I actually do want to go and see what this group offers, it's canceled or there's not enough people here. So we have to like defer it to another day. So it was just a lot of challenges with that. And so I did get my undergrad degree. I didn't let that stop me, but I wish that my university would have had more welcoming advertisement for student parents, because student parents matter as well. And it's a huge milestone for us to have a child young in high school, or not even in high school, but just have a child young and go to college and finish. That's something that, is big.
Yeah, absolutely. I hear you on that. What about you, Na'Asia? What was it like being in high school?
Well, to start off, at first it was okay, but then it got like kind of hectic when it's like at certain places they don't have certain programs that you need, or it's like, how can I put it in words? It's like my situation was different. It was like I didn't have enough at the time support team to like back me up with it. So it was like it was hard with in between school and doctor's appointments and etc. So I mean, I can say we need more programs for teens like us being in high school because it's hard, or college like teenagers. It's very hard.
Yeah, thank you both for sharing that. So I know that another issue that we've talked a lot about is housing and just being able to navigate housing. And housing can be a huge barrier for so many young people. And then when you think about young people who have children, it can be even more of a barrier. Jenny, do you mind sharing a bit of your story about how you've been able to navigate the DC housing system with your son?
Once I had my son, I was still staying with my aunt. Me and my aunt, we didn't really get along like that, so I eventually ended up leaving our house, went to my sister's house. My sister ended up telling me about Virginia Williams housing, little resource center. I called them over the phone the same day we talked. They placed me into a shelter the same day. Got to the shelter. Their conditions wasn't really, good up top. So I've been at the hotel for about 3 months. I didn't really like their process of getting checked in, checked out every day, daily. Room checks was every night. Sometimes my son would sleep. They'd come banging on the door. He'd wake up, disturb his sleep. I didn't really feel like it was, private. So once my 3 months came, they eventually placed me into Elias Cradle. It's a transitional housing program. So that's where I'm currently at now, working my way through the program. So that's been my experience so far.
Yeah, well, thank you for sharing that experience. So Dejanay, I know that your story is a little bit different than the other panelists because you aged out of foster care shortly after you had your son. So can you talk a little bit about your challenges aging out of the system and also how you were able to finally find housing and other services that you needed?
Yeah, sure. Aging out of the foster care system was really scary, to be honest, because from 15 on up to the age that I aged out, I had people surrounding me, basically doing things for me. So I wasn't used to really doing things myself. And that was one reason why I was scared of aging out. And my team made it sound so, sweet, like it would be a smooth transition, like it wouldn't be an issue transitioning, and that we would have this and that in place for me to be able to, basically tap into what the real world had for me. And after aging out, it didn't really go as planned because my team was very dysfunctional throughout my whole foster care years and everything. So it took towards the end of me being in foster care for my team to actually pull together and start doing some things when I got a CASA. So that and aging out, I had a plan for myself, and that was to stay in the transitional home that I was in, because they allow you to stay after you age out for like 2 extra years. And they had a daycare center that my son was attending, but due to him getting hurt badly in their daycare, I had to move out of that program because I then felt it wasn't safe for my son. So then I did the same thing Jenny did, and I went to Virginia Williams and stayed there from 7 in the morning until like 7 in the evening, talked to a social worker and everything, and they placed us in a hotel. And yeah, I can agree with Jenny as far as the hotels not being livable for a baby. you know. And for me being an adult, it's okay for me to be there, you know, because I know how to live in certain situations. But as far as it being kid friendly, or as far as it being sanitary enough for a baby to stay there, like my air was like my heat, it was wintertime, it was in December, so my heat wasn't working in my room, my ceiling was leaking, and it was roaches. It was just a mess. So basically, I ended up moving from there to stay with someone. Basically, you know, moving from place to place until I found a apartment of my own, and then I work at CASA for Children of DC. So they ended up giving me like a rental voucher and helping me deal with things as far as my apartment goes. And now I have.
I think, did you go on mute? Dejanay, you were still talking, but I think you were muted. Okay, so thank you so much for sharing, Dejanay. So I am, now we're gonna move to recommendations. So we're gonna go back to the question of what do young parents need to thrive? So I have asked them all to think long and hard about what they wish they had when they were navigating different systems, pregnant and also with a young child, and what things worked well for them and what things they would like to recommend to our audience that's listening in today. So these are all policy recommendations, program recommendations, advocacy recommendations. So I hope that all of you that are listening will take notes as they provide you with recommendations. So I am going to start with Tanasia. If you can share your recommendations for this audience.
Yeah, thank you. So I am recommending that the policy and the requirements for obtaining a childcare voucher should be amended. I feel like it is a long process to receive a childcare voucher, and some of the things that you have to go through, I feel like should not be there, especially when you are a student parent. And so I just feel like some of the things should be minimized or just taken away as a whole. And then my second recommendation would be to put apprenticeship programs in all DCPS schools, because I understand that college is not for everyone, but everyone deserves an opportunity. And if they can pick up a trade, you can pick up a trade while you're in high school. When you graduate high school and you enter the real world, you have something, you know, on your resume where you can start. For example, I know Blue State has cosmetology classes, but that's for, you know, nighttime. So why can we not have that in schools during a regular day, and we can kind of like put this in student schedules and things like that.
Great, thank you, Tanasia. Jenny, what would you recommend?
I would recommend that DC creates more housing programs for single mothers and single fathers, because a family do not have to just be a mother and a child, or mother, father, and a child. It could just be a single father taking care of the kids. So I would recommend that. My second one would be like more family resource centers other than Virginia Williams, because that's all you get pointed to nowadays is Virginia Williams. And I don't feel like they do enough for, you know, single parents and their kids. That would be it.
Thank you. What about you, Naisha?
I would really piggyback off of Tanasia about the daycare vouchers, because that's a really big issue. It's like a really hard process to go through with the vouchers. So that's my only recommendation, is about the vouchers. Like, that's a really big issue that we need to take a part of and start having more discussions about it, about rearranging the process of it.
Absolutely. Does anybody else want to chime in about that? I know it came up a lot in our discussions.
I wanted to also say that with the process for child care vouchers being so hard, it's hard for us to be able to go to school or work, and those are one of the requirements for us to be able to obtain a voucher, to be working a certain amount of hours at work or to be going to school for a certain amount of hours. And I feel as though we can't go to school to meet that time criteria if we have to keep staying home to watch our kids, or some of us don't have a huge support system where some of our kids can be supervised by family members or close friends that we confide in, So I definitely agree with Tanasia and Naasia about, making the childcare voucher process a little bit easier, maybe a little bit simpler for us to be able to, get our kids in school so that we can obtain all of the education that we need on top of, working to be able to provide for our kids, because we can't provide for our kids with no job, and we can't get a daycare voucher with no job either. So there's nowhere to win in between there.
I definitely agree. Yeah, we said that at the same time. I just don't understand how, they expect you to seek a job when you're sitting at home with your child. You can't do job interviews with your infant or your toddler sitting right there with you. And if you could, I'm sure many people would do it. However, it's just something that hinders you from moving forward. And then it's just a process in general. Like, what does me, what does my hours at school or my hours at work have to do with the childcare voucher? What if I'm doing school and work? What if I'm doing both? Does that mean that my child gets extra time at daycare? If I'm not doing both, does that mean that I have to pick my child up from daycare at a certain time? So it's just like those questions that sit in the back of your mind about childcare vouchers and even childcare facilities. I don't think there's enough spaces in childcare facilities for children. So when you talk about childcare as a whole, I feel like that's another summit in itself.
Yeah, you guys have a lot to say about that for sure. I know we were talking about it nonstop, it seemed like. So definitely an issue that we definitely want to elevate and highlight. So before I go to Dejanay to give her recommendations, I just wanted to ask the audience, if you have any questions, please do submit them. We're going to go to Q&A after Dejanay gives her recommendations. So go ahead, Dejanay.
Okay, so one of the recommendations I had was to, start a different, like Jenny said, start a different family resource program, something that's not Virginia Williams, because to my understanding, Virginia Williams has more than just moms or dads with children there in their facility. They have people who are like, on drugs and dangerous people, and that would explain why you would have to get checked every day, which is understandable. But what I'm trying to get at is, if there was a different program in place for that, then there would be no need to, scare the children with checking their bags, or they see guns, so they're scared now, and you got to warn the kids when they come in, and that makes it scary for children, and they can interpret that the wrong way. So that's one of my recommendations, to have a different family resource program that secures housing that's not Virginia Williams. Or if it's going to continue to be Virginia Williams, then the criteria for Virginia Williams should be changed to only moms or dads with children, and not other people in the community that's mixed up with the children, because that's not safe for a child to be, on the same facility as someone who maybe has a drug addiction or an alcoholic addiction, because then that whole facility becomes unsafe and compromised at that point. So, my second recommendation was to have more mental health programs in schools for women and men as well, because I know it's a lot in the Black community that mental health is not really acknowledged much And I, being the person who I was navigating through the foster care system with my mental health issues, I realized that there were not really anybody there to, you know, talk to when I was in school or going through what I was going through and all of that. So I feel like mental health programs in schools and either a different family resource programs or, you know, a rebuild of the criteria for the ones that we do have. I also wanted to add that some of the social workers for these programs are not passionate about their job, which also makes it very hard for us to be able to do what we have to do, because it's not okay for us to be told that this is how it's going to be 1 minute, and then the next minute when we're reaching out to this worker, the worker is not there to support us as they said they would. And that's, you know, very rough.
Great. Thank you all so much for those recommendations. Does anybody else, we're actually ahead of schedule. Does anybody else have any more that they would like to add before we open it up for audience Q&A?
I was going to add about the daycare vouchers after Tanasia was saying, and it's not only it's mainly on like if you have this many hours of work or this many hours of school, but like sometimes they want both parents, and half of the time it always doesn't be both parents in the child's life, and that also affects you getting a voucher for your child to be in daycare. It's like it can only be a mother and their child or a father and their child, and it will affect because the father's not there or the mother's not there in the child's life, and it can really affect the voucher, because that's my situation and it affected me very heavily. So I just wanted to add that.
Thank you for adding that. I
wanted to add the fact that I wanted to just piggyback off what Asia said for just a second and say that just because a mom and a dad is taking care of a kid together doesn't mean that they have it all together, you know, because a father may not have a job, but he's looking for one, and things like this, like a pandemic may come through to where both parents are just in a drought right now. They're both, you know, trying to manage with what they can. And the way that the system is put together makes it to where you have to put your baby father on child support to be able to get some services. But what if he's already there? You know, like what if he's already helping out? What if he's already taking care of his kids? So we have to put him on child support to get assistance from the government, and that's not, you know, it shouldn't be that way either, because some dads do take care of their kids and some dads don't. But in this case, putting your baby father who is taking care of their child on child support, so that way you both can be able to get services for your child, it's a hard decision to make. But on top of that, like, parents look at it like, we're going to do what we have to make sure that our kid is provided with what we need as far as, you know, everything, housing, food, everything.
Thank you. Tanasia, were you going to chime in there?
I was, and I guess I would just like end it off with, and this is my message is for the viewers. I hope that you guys are watching and you understand where we're coming from and that you're taking these recommendations into consideration.
Great. Thank you all. So we have a couple of questions that came through. So I'm gonna start with those questions. So the first question that we have, and it's really for any of you that would like to answer, is what can the public do to help young mothers?
I would say the public can first. One thing that the public can do to help young mothers is stop bashing us. Because first, for us to be young mothers, we are very smart, we're very intelligent, and we're more than just young Black women who were being grown one day and had a baby. You know, we have more than just drama on our mind. Like, we're trying to make ends meet for our kids, and not every mom doesn't take care of their kids, and not every mom out here, you know, is just trying to be on government assistance to live on it forever. You know, some moms actually need government assistance to boost them to the point where they want to be in life, to the point that they can let that go, you know. And it's hard for us to do that with these barriers in place and also it discourages some moms because of what people think of them, and that also ties into the mental health piece because you're already dealing with your child, and then you have to deal with how hard it is to get a voucher for your child, and then you have to deal with how hard it is to get housing, and then you have to deal with how hard it is to get a job because you can't find anyone to watch your child, and then it's just very hard. I feel like so the main thing that the public can do for us young women is support us, and that support goes a long way. That support is very strong and critical, actually, to be honest. Because like Jenny said, she didn't have a huge support system. So her not having a support system made it harder for her to navigate through the government systems because of her not being able to have anybody.
Yeah, I totally agree. It's like they see one person and it's like they piggyback off of the negative energy and they ride the wave all the way like, oh yeah, she's like that too, and she's like that too. So all of them are like that. Every mother is not the same. You have some mothers that want to strive and do the best for them and their child all the way through, like riding the train all the way through. And you have some mothers that want to ride that wave until like they can't ride it anymore. It's like, and I totally agree with you, DJ Dodger. I'm sorry. I totally tried you now. Sorry.
That's okay, Nasia.
I'm sorry, DJ. But I totally agree.
Thank you. We have some more questions coming through. So the other question that we have is, what would an ideal family resource center look like, and what services would it offer?
Can you repeat the question, please?
Yes. What would an ideal family resource center look like, and what services would it offer? Maybe Tanisha, do you want to take that?
I saw Jenny come off mute, so I'll Jenny, you take
Go ahead, Jenny. I didn't see you.
Back. You sure?
I think an ideal family resource center would look like, mothers, fathers, their kids, just looking for people to go to get help when needed. And to also, sit in front of somebody that, understand like where that person is coming from. Like, not just sit there and do the work because you have to and you really don't want to, but sit there and really try figure out a way to help that person, get to where they're going with their kids. Like, I don't know. That's what I think.
Thank you.
I definitely agree, Jenny. I feel like a family resource center will provide wraparound services. So, DJ mentioned mental health. So that's something that will be offered there. We talked about daycare vouchers. So the family resource center will help parents, get daycare vouchers. Also, find housing, we've all stated that no family is the same. Every family is different. You may have a family, a mom, dad, and a child. So, have someone there that can support that family. You may just have a mother and her babies. So, have someone there that can support that mother and her family, or just a single father trying to navigate, the stigmas for fathers as well, teen fathers, as well as like fatherhood, and then trying to raise that child on their own. So have someone to support, that father, mentorship programs, even though you are at an age where you're considered no longer a youth, a mentor is still something great to have in your life. Someone who has been through what you're currently going through and can help you navigate out of that situation. And so I just feel like a resource center will provide wraparound services for families, and it would just be for families.
I feel like for me, an ideal resource center would be, of course, drug-free, and it would have passionate workers actually wanting to do their job, like they said, not just sitting there for the check. Because I noticed that a lot. That's something that I noticed a lot going through these programs too, is you have someone sitting at a computer who's asking you all these questions, and, acting like they care. And then at the end of the day, it's just like, well, I got a home to go to at the end of the day, and that's the attitude they give off sometimes. And that's not a really good attitude to have. But that on top of, like the girl said, we talked about daycare vouchers. So an ideal program or resource center would be to provide a easier standard of having to obtain daycare vouchers for your youth. It would be to have programs to help us do job searches or to prepare for a job interview, or, to have like a little closet with attire in it for us to prepare for the interview as far as looks, a closet for kids and moms who don't have clothes, just coming off the street. That will help. Giving us like serving meals, that will help. And I understand that, but it's some programs that are that way, but I feel like the main piece will be to have the workers more passionate about their work.
Yeah, that's a big thing.
I feel like some of these programs will honestly be effective if the workers actually put forth 100% more effort into what they're doing now. Because right now, like I said already, it's just like I'm working to get my check and then I'm going home. Like, you're not changing lives for real. So
it's about a support team.
Right, and that's why we have this never-ending cycle of women who are homeless with kids, and then we're going to Virginia Williams and sitting out in their building for 7-8 hours a day, going to hotel rooms, and then you got to leave the hotel sooner than what you expected because it's not a good living condition for your child, and all of that. So I feel like that all ties into having a good family resource program. That will all tie into that.
Yeah. Thank you for all of that, Dejanay. So we have a few more questions to get to. So someone typed in, if I am a young mother, where do I go to get resources?
It depends on what kind of resources you're going for, because I wouldn't go to Virginia Williams for any housing resources at all.
I was about to say, don't go to
it's just a waste of time, to be real, because you will sit in there until like 7 o'clock you have to get in there at 7 o'clock in the morning, because if you don't get there early, then you have all these people ahead of you, and then you're just sitting there to be seen the next day, to be seen sitting there again until 7 that day.
Yeah, it's not bad
about the program. It's just a hotel that
like you don't go nowhere.
So
right.
Even if you sit in there all day, you still won't get nowhere. You can sit in there from 7 a.m. to 7 p.m. and they still won't help you. They be like, come back.
So can we think about where would you recommend someone to go to find helpful services? I think we know what may not be helpful, but what would you guys say?
But the only place to really go is Virginia Williams. That's the only place that offers the stuff, but it's
that's
like they don't really help. They don't help. So it's like a dead end, really. And I don't even want to like say it like that, but it's like kind of like a dead end. And it's sad to say that's the only resources that we have, and it doesn't even help us strive or go to what we need. And it's sad to say.
That's what I'm saying. Like the housing program I'm in now, you have to go through Virginia Williams to get in. Okay. It's like you can't really go nowhere besides Virginia Williams to get placed nowhere else. That's exactly where everybody else is going to place you. You can't look up nothing on the internet because it's only going to say Virginia Williams.
Okay.
It definitely is.
Just to clarify for our audience that may or may not know. So if you are a young pregnant mother or soon-to-be mother, you have to go to Virginia Williams to get support services started for you. I feel like
the only place you don't have to go I feel like the only way you don't have to go through Virginia Williams is if you're in foster care, because like I said when we were talking like previously before the panel, like it's a whole lot of programs and everything in place for women who are pregnant or with kids. Like when you're in foster care, they move you to the top of the line when you're in foster care. But when you're not in foster care, you're moving at small spaces. Nobody really cares for real. The way they express it the way they express it when you're in foster care. And it confuses people too, because they have you thinking that your transition is going to be just
Right. So we have a couple more questions that I want to get to before we close out. So another question is, as a teen mom myself, I experienced discrimination when trying to enter programs that would have helped me stay in high school. Did you all experience that too? And if so, how can we overcome that as a community?
So I would say I'm sorry that you experienced that first and foremost. Like you should not have experienced that, have went through that. I didn't experience any discrimination with my school. My school actually set up I want to call it like a support plan for me when I did go out on maternity leave, to where as though I went and picked up work and dropped it off, and I met my teachers and things like that when I was in high school. Um, I will say that I did get, kind of smart remarks when I went to like the DHS office or to WIC, and I'm young and I have my son, and my son's dad is there, and people are looking at us and they're like, well, where are your parents? And you're too young to be a parent. So, I did get those comments, but I think one thing to overcome it is just to prove them wrong. You know what you're capable of. There's no handbook to parenting. And to whoever sent this question, I'm sure you're doing a wonderful job with your child. And so just remember to continue to uplift yourself, because it's sad to say, but society will break you down. So you have to be that person who picks yourself up and you say, okay, I'm going to do this. I'm going to get through this. Like, be that inspiration for yourself and for your child.
Yeah, and they say that, and one thing I have to say is, they say that it takes a village to raise a kid, but there is no village. So what village is going to help you, And not even only that, but one way that I was discriminated against a lot was when I was in foster care. And going into foster homes, or dealing with caseworkers, like I said, who were not passionate about their job. When it came down to it, it's hard for me, it was hard for me to express how I felt to caseworkers and stuff like that, because in the program that I was in, like, if they get mad at you, they're spilling your business. And that makes it hard for me as far as, healing and getting better at, mentally coping and all of that, because if I feel like there is no one in my corner in this program, and I feel like if you guys don't have my back,
I think she muted. I can't hear her.
hit obstacles, and trust me, I've hit so many obstacles, so many, but I keep pushing and you keep going. And with that determination, you're going to eventually be where you want to be in life.
Okay. That was really great sound advice from both of you. Thank you. So I'm going to take one final question. And this is a question that came up a couple times. People want to know, how do you all currently handle stress? What do you do for self-care? How are you all taking care of yourself? And I think I'll start with Jenny. I see that you're off mute. So I'll start with you. How are you taking care of yourself?
I take care of myself, once in a while. But like anything I get, it goes towards my son. Like any little money I get goes towards my son. I might get my hair done once in a while. Like I don't do it often. Might buy something for myself once in a while. But anything that I get, it goes towards my son, because, like I said, I'm a single mother. Never know when the next time I'm gonna have money or he gonna need something. So anything I get, I just buy his stuff in advance. Like that's it. That's all I can say.
I'm gonna agree with Jenny on that, because one way that I deal with self-care is, I like to do my makeup and I like to do my hair a lot. And I like to listen to music. Actually, I've learned a whole lot of my stress relievers through a worker from Hillcrest, and her name is Miss Stacy McGann, and she told me a lot. Like when I first got into foster care, I didn't have any, mental health coping skills or anything, but working with her for the long period of time that I worked with her, she really honestly showed me how to be humble and use the coping skills to my advantage. Even when I feel like they're not working, they're working. And sometimes I've learned that mental health is like a mind game sometimes. So I feel like one way for me to be able to deal with myself when I'm dealing with things like that would be, like I said, to listen to music. And I feel like writing often sometimes gets it out of my head and on paper. And now I'm writing a book about it, so about my life. So that helps. That's effective. Hot showers, all of that. I like playing with my baby. He makes me happy. So I'm dealing with self-stress pretty good.
Great. Thank you so much. So we are going to move into our closeout. And so given that we are currently in what some people have referred to as a double pandemic and a summer of reckoning due to the recent violence and murders of several Black men and women and the international uprising demanding for justice and accountability, I would be remiss to not point out the fact that all of our panelists are currently raising Black boys that right now are cute and adorable, but as they grow up, this may very well change. So with that, I have asked them all to share one word that describes their son and why, and to also share with us their wish and dream for their child, despite how the world may see, limit, or judge them. So I am going to start the closeout with Tanasia.
I knew you were going to stop me, and I was like, this is where it gets emotional.
Yeah, this is a heavy question.
It is. So this is my picture. And this is Jalil here in the middle. And one word to describe him is gentle. My son is really gentle. He's always like, Mommy, are you okay? Is there anything I can do? He's always like, well, you look like you had a rough day. Maybe you need a nap. Like he's always putting, us first. And so, when we practiced this, it wasn't this emotional.
Yeah. Aww.
I think my wish for him. Ooh, y'all, for real.
Yeah.
Just say
it. It's okay. Get it out, girl. It's okay. We all understand.
My wish for him is to be successful. And that's on any level or platform. It's just that when you look at your child and you see the gentle person that they are, and then as they grow, society portrays them in a different way. So it's like, when does my son go from being gentle to becoming a thug or, a person who has his life taken away? And that's something that I never want, for my son. I want him to grow up and to be successful. My son knows at 8 that, I said college is not for everyone, but me and his dad have both told him, you have to do at least one semester for college, just to get the experience. And if you don't like it, that's okay. We'll take the money that we have for your college fund and put it towards a trade. Or if you want to open a business, you can do that. My son is always saying, the other day I said, what do you want to be when you grow up? And he was like, a scientist. And I was like, okay, well, what are we experimenting on? Let's start now. But his wish is changing every day. And my wish for him is to just to love himself and to know that he can be who he wants to be. And mommy gonna support. I'm gonna stand behind him, 10 toes down. But sorry, y'all, I got emotional.
No, that is quite okay, Tanasia. It is a very heavy question, one that I don't have children yet, but one that I know I'm gonna have to think about when that day comes for me as well. So thank you so much for sharing that, and thank you all for being so vulnerable. Who wants to go next?
I'll go next just to get it over, but
go ahead, Dejanay.
Let me see on my phone. All right, my picture's here. See, and this is D'Angelo, and he's 2 years old. He's actually awake now, but if I put him in the camera, he's going to be too out of control. So I'm just going to speak about him. One word I had for him was energetic, and that's because he's always up and running around, and he's also very caring, like Tanaja said, very loving, and sometimes when he wants to be very gentle. And one of the wishes that I have for him when he get older is to not be looked at by society as, like Tanaja said, like a thug or, you know, like a murderer or anything like that. And me on my end, I'm working as hard as I can to make sure that I instill all of the knowledge in him that I know as far as being successful, as far as I know of being, you know, educated and everything. And despite my journey and all of the obstacles that I have been through, I feel as though my son's life, what I went through, doesn't reflect his life. And it doesn't reflect how he's going to be as a person, because some people feel like things happen generationally, but I honestly feel as though generational curses can be broken. And I am going to do that with leading my son the way I feel like he will become a leader. And that's how I want him. That's the you know, goals that I have for him when he gets older. And not that, and to basically take care of his family, you know, take care of your family and, you know, just be successful and stay out of trouble. Every mom wants their baby to be something in life, you know.
Thank you so much, Dejanay. Who wants to go next? Naija or Jenny?
I'll go next. This is Tated. My word for him was loving and caring, because one thing that he do is make sure I smile. Like, no matter how I'm feeling, he just, you know, he's there to brighten my day. My goals for him, I said I would want him to, you know, have standards for himself. I do want him to finish high school. However, if he don't want to go to college, then I'm not going to force it on him, because school is not for everybody. As long as he go out and make, you know, have a good job, make a good living for himself, that's all I ask. That's what I said.
Oh, hey, baby. Okay, Naija.
This is my son, Joshua. He's into the water right now. I'm sorry. One word I would use to describe him is independent, and another word is loving. He's like, he doesn't need me. It feels like he don't need me anymore right now, and it hurts my feelings to say I always be crying all the time about like he doesn't need me no more. Like he'll brush his teeth on his own, he'll take his bath on his own. It's like he doesn't need me. But one thing I want him to do in life is just to strive and shoot for the stars in everything he does, no matter what it is. Like today, to say I'm on the train and I'll ride until it ends.
Yes. Wow. This has been just so amazing. Just beautiful. I just want to, I guess my word that I would choose would be inspiring. Inspired. I am just so inspired by all of you, passionate, smart, just amazing young women Thank you all so much for being vulnerable. Thank you all so much for trusting this process. Thank you so much for sharing your story. Thank you so much for being able to walk us through what it was like for you all. And so we started out by you all sharing sharing a word that described how you navigated the system. And then we ended with you all sharing a word that describes your son. Again, I can't thank you all enough. This has definitely been amazing experience for me to be here as your moderator, moderating this panel and organizing this panel. And again, I just want to thank you all. And if you guys have any last words, then you guys can say your last words as we officially close out. Any last words that you guys want to leave us with?
I just want to say it again now that everybody can see it being said. And I want to say that I commend all three of you all for taking this step to improve the community of moms, dads, and their children. This is not an easy topic to discuss, and it's not easy to speak on vulnerable things, like Samara said. And for us to come on here and do this is very strong to me. And I really, really appreciate you, all three of you, for, opening up and being a voice for the moms who can't, speak or advocate for themselves.
I just want to say, I agree with you. Like, it was, and I had like an amazing time meeting you, Nate, you, Jen, and Tanisha. Like, this was a wonderful experience. And I just want to thank you for all having me to participate in this and share my voice and my opinion on today's society about mental health, maternity, and everything else.
Yeah, I totally agree with what has already been stated. I think this panel was a really great one. It had really strong women up here, really strong moms. Some of us are in school, some of us are starting our own businesses and writing books. Some of us are, working and just navigating life all in itself. And I hope that speaks to all teen moms out there to say, like, hey, I did have my child. No, he or she was not a mistake. And I'm going to continue to go on with my life, and I'm going to make sure that I create a better life for my child. And to you, Samara, thank you so much. You were a beautiful moderator. And you were really open and vulnerable yourself, because you allowed yourself to get to know us and look deep into us and what we want for our sons. So thank you as well.
Oh, thank you. Jenny, any parting words?
I think I agree with everybody on here. This was helpful. I just never seen myself doing this before, but I did it. And just thank you for helping along the way.
Well, that's it, everyone. Again, I just want to thank this fabulous panel of women. Again, getting to know them has been quite an honor for me. You all are fabulous. You all know how I feel about you. And just continue to keep doing amazing things and sharing your stories. Your voice is so powerful. Thank you all for joining us. Bye.
Please welcome back Dr. Faith Gibson Hubbard, Executive Director of Thrive by Five.
Good afternoon, everyone, and thank you so much for joining us today for these phenomenal breakout sessions. I have to say, as I'm coming to you live from my son's room, since it gets the greatest lighting in the house, that I have been so inspired by each of the conversations that we've had today, and most of all by the panel of moms that just went last. I was really touched by so many of their stories as I think about the struggles that my mom had with me when she had me as a teenager, and just really inspired and encouraged and even more excited to join tomorrow as we have more wonderful breakout sessions that are coming up on Thursday, which is tomorrow, and also Friday. We hope that you will stay connected by either using the Hoover app on Facebook Live, on YouTube, or that you will go on to dcmaternalhealth.com and continue to look at the agenda for the rest of the week. We have an action-packed and really, really phenomenal agenda still yet ahead, and we look forward to continuing the conversation with you on all of the different platforms that I just mentioned. So have a good rest of your afternoon, and I look forward to seeing you tomorrow morning.